Good morning and welcome to the first annual Community-Engaged Scholarship Symposium. I am Debra Clark-Jones, Associate Vice President of Community Health at Duke Health and Duke's Office of Durham and Community Affairs. I am honored to have the opportunity to welcome each and every one of you joining us. And I am thrilled to take part in this important and timely inaugural event. Today's symposium is hosted by Duke Civic Engagement in partnership with the Duke Clinical and Translational Science Institute's Community Engaged Research Initiative. This partnership is a university and health system collaboration. Partnerships is the primary theme for today, and you will learn about more collaborations throughout the day as reflected by today's speakers and panelists. The two primary aims for today's event are to highlight the work of successful community academic partnerships and to serve as a platform for networking and information sharing. The issues we face within our communities are complex, multi-layered, and at times the solutions feel daunting. There are some that believe solutions, real solutions, are out of reach. Fortunately, most, if not all of you in attendance, believe that change is possible. You possess and exhibit the know-how, the passion, and the commitment needed to overcome the challenges facing our communities. While what we each offer individually is important, going it alone is not a formula for success. I'm reminded of a quote which says, "Great discoveries and improvements invariably involve the cooperation of many minds. Together, as partners, we can overcome our most intractable challenges." While partnerships are necessary, they are not always easy. John F. Kennedy reminded us, however, that partnership is not a posture, but a process, a continuous process that grows stronger each year as we devote ourselves to common tasks. Part of this process includes building trust, respecting one another's capabilities and capacity, and ensuring balance in the power dynamic in the relationship. Through our speakers and the examples shared today, we will learn more about the promise and the impact of partnerships, as well as the elements that make for successful collaborations. We have a phenomenal lineup, including Dr. Wanda Boone, founder of Together for Resilient Youth, who will provide our morning keynote. Dr. Boone will be followed by a panel focused on partnerships addressing emerging concerns, featuring representatives from Latin 19, the African American COVID Task Force, also known as AACT Plus, and Coastal Climate Resiliency. This afternoon, we will hear from Dr. Viviana Martinez-Bianchi. Following Dr. Martinez-Bianchi's talk, we will have a panel discussion on collaborating for impact, featuring university-assisted community schools, communities in partnership, and families and communities rising. I'll close by citing an African proverb that tells us if we want to go fast, go alone. If we want to go far, go together. I hope you are as excited as I am to learn from our speakers and panelists today on how we can establish partnerships that allow us to go farther than we have ever gone before, and our shared commitment to strengthen our communities and provide equitable opportunities for all. I will now pass it over to Sabrena Mervin-Blake. Thank you.
Good morning, everyone. I'm going to introduce our keynote speaker this morning, Dr. Wanda Boone. Dr. Boone is a forerunner and recognized expert in the field of resilience, adverse childhood experiences, and trauma. She believes that children thrive when the adults that surround them are well and do well. In 2000, she founded Together for Resilient Youth, also known as TRI, after 20 years in the corporate sector. TRI connects the dots, linking the public health model, trauma-informed care, and transformative prevention. Based in Durham, the organization now has a presence across North Carolina, the US, and internationally in Kenya, the UK, and Australia. Dr. Boone is a member of the North Carolina Adverse Childhood Experiences and Resilience Advisory Board, Health and Safety Chair of the Durham City County Task Force, and has served as the co-chair of the National Institute of Medicine Healthy NC 2030 Social and Economic Factors Work Group, focusing on the impact of trauma and the importance of resilience. She's a registered nurse and holds a master's and PhD in theology and public health. Please join me in welcoming our keynote speaker, Dr. Wanda Boone.
Good morning. I'm so pleased to be with you. This is exciting for me, and I will share my screen with no mishaps. That's step one. So thank you so much again. It's a pleasure to be with you. I've been a community-engaged partner with Duke for 12 years, years that have passed so quickly. I still can't believe it. So I'm going to talk about partnering to address emergent concerns. String beans, that's where we're going to start. And it seems like a very strange thing, and perhaps it is. But I want you, we don't have time to talk about it too much, but I want you to look at the string beans, to think about what memories come up because of string beans. And many people talk about being with their grandparents and all those kinds of things. And even there are those people that I've spoken to recently who say, I don't know anything about a real string bean, mine come from the can. So whether your experience is from the farm or whether it's from a can, we have a common experience with a string bean. If you want to experience communities authentically, we have to question history, embrace the unfamiliar, and challenge our own explanations of reality. So we're going to go from string beans to something that looks like this, because this is what community looks like if we're all at the table and we're enjoying those things that we may like, and someone else may be say, I would never touch that with a 10-foot pole. And regardless of the 10-foot pole, there are still individuals who are at the table that have personal likes, personal dislikes, and we share a commonality in being at the table. So how do we address this composite picture of things that we like, things that we don't like, people that we're not accustomed to? Question our reality. We all come from different spaces, different cities, different experiences that have been with us for many years as they've been cultivated by the people around us. But then we have our own personal experiences that form and shape our opinions. And this is where we need to start to talk. So the first thing that I want to do is to connect the dots to address emergent concerns, because they're varied, they're wide, and they are broad. At the top, we see adverse climate experiences. And that has to do with climate change, but it also has to do with how different communities experience natural disasters or even COVID-19. We understand that it hasn't been the same. And so how we take the table with all of these different partners and decide to focus and concentrate on COVID, we've done that, many of us. And then there are adverse childhood experiences. And this all ties in together with who we are as individuals and how we present ourselves as members of the community who work together. So adverse childhood experiences or trauma can lead to chronic disease, substance use. And for those who don't know what those are, there are 10 things, well, 11 now, that may happen before someone's 18th birthday that impact their experience in life later on. Those 11 things are, if before one's 18th birthday, there's a history of abuse, physical, emotional, or sexual, neglect, physical or emotional, or within the household, there's mother treated violently, substance use, an incarcerated relative, substance use or divorce, then those and racism is now the third. And so 11th. And so we understand that if someone experiences these things 4 or more before their 18th birthday, then that is a challenge. If they experience 6 or more before their 18th birthday, it could lead to 20 years less life expectancy. So whether we're talking about COVID-19 or whether we're talking about trauma, now we see the emerging concerns that can be addressed with the public health model. So those outcomes can be lack of physical activity. Think about this, because one or more of these may be in your wheelhouse of prevention. Lack of physical activity, smoking, alcoholism, drug use, missed work, severe obesity, diabetes, depression, suicide attempts, STDs, heart disease, cancer, stroke, COPD, or broken bones. Did you find something in there that we as a collective want to do something about? Of course you did. And so we have adverse climate experiences, adverse childhood experiences, and then adverse community experiences. In the built community, it's not the people, it's the built community. In the built community, there's more violence. Housing affordability is it's an issue for many people, and limited access to the things that lead to health and wellness. And so again, here's another layer of adversity that should be addressed. And we address those sometimes when we think about the social determinants of health. Economic stability, education, health and healthcare, neighborhood and built environment, and social and community context. And so the other thing that I will talk about in a minute is the bottom rung, if you will, or the roots of that tree, so important. Under economic stability, we find poverty, employment, the situations of food insecurity, housing instability. I don't have time to go through this today, but in each of these areas, we have pinpointed and others have pinpointed the areas that they are now working on. And this gets to how do we work together? Under education, we have high school graduation, enrollment in higher education, language and literacy, early childhood education and development. Under health and healthcare, access to healthcare, access to primary care, health literacy. Neighborhood and built environment. We have access to foods that support healthy eating patterns, quality housing, crime and violence, environmental conditions. And under social and community context, we see social cohesion, civic participation, discrimination, and incarceration. So let me just go back to the tree for a minute, because after adverse community experiences, and let me just make that a little bit more clear. So when we're driving through neighborhoods, we see neighborhoods that have grocery stores, produce, sit-down healthy restaurants, or sit-down restaurants in general. We see parks that are able to be used because the equipment is in good repair. But in a neighborhood or a built environment, a built neighborhood, you don't have those things, and you can spot them immediately. No restaurants, sit down, only fast food restaurants, no banks, grocery stores, convenience stores and gas stations instead of grocery stores. We see that it's not safe even in daylight, although violence is spreading. And so what I want you to understand is that it's not the people. It's what the people have access to based on where they live. And so how can we help that? Because that's so huge. And I went through the social determinants of health, and I can provide you with those ways in which we all can work together in order to increase the health and well-being of all of our citizens. In the roots are atrocious cultural experiences. This has to do with historical trauma, harmful social norms, racism. So we talk about slavery, genocide, what happened with Native Americans, what happened with Japanese Americans, what is still happening with Black Americans, forced family separation, segregation, and harmful social norms. And so the impact of atrocious cultural experiences impact our DNA. So if ACEs is not the issue, if adverse climate experiences is not the issue, if adverse community experiences is not the issue, then there still needs to be healing because of atrocious cultural experiences. A resilient person has the power to help create a resilient community and impact the many. So how do we do this? One of the tenets of resilience, and these seem so simple, it's almost like the string beans. We have a memory of string beans that uplift us. And I'm not saying that string beans should be what you concentrate on in order to answer these questions. But when an individual has challenges with trauma, then these are the things that need to be focused on. And we can all focus on them in order to feel better, to present ourselves to the world in a better way. But a person with high ACEs, for example, doesn't automatically think about these things. Rather, it pulls an individual into isolation and a place of hopelessness. And to replace that, we can answer the questions: what or who uplifts you? What or who gives you strength? What or who helps you get through hard times? And then, and this is real science, every child, and I would say every adult, needs at least one adult who is irrationally crazy about him or her. No judgment. When we're at the table, and the table can be in the community. The table can be in an office. The table can be at a conference room table. But the way that we show up really makes a difference. We have to somehow get rid of the judgment, the implicit bias perceptions that we have. Even today, people may think, who is Wanda Boone? And where did she come from? But you know what? It doesn't matter, because I am a part of you and you are a part of me. Equitable engagement. The conventional way of thinking about prevention, or unfortunately, some of the ways that people think about individuals that have challenges because they're in a built community, that have challenges because of trauma, which has resulted in those outcomes that we saw, or even those who are incarcerated. The conventional thought, people are bad, people need to be punished. We need to stop making excuses for people. And what is wrong with you? Trauma informed, which is where many people are at this time, thinking about and talking about. Trauma informed says people are suffering. People need an effective intervention. We need to focus how trauma impacts development. And that question is, what happened to you? And that's a good question, but there is yet a better way. And this is where TRIBE focuses, and I hope you'll join us. Resiliency informed, transformative prevention. What does that look like? People are resilient. The fact that we are here today, and whether someone is in a vulnerable SVI or whether they're living in wherever, the fact that someone succeeds to make it to another day is the bottom line of resilience. So people are resilient. People need our compassion as they learn new skills. We need to learn how skills of well-being can reduce suffering. What is right with you? What are your strengths? So when we start to think about how we embrace people into the fold in order to be among us in our participatory research, or just wanting to be together. We don't go to one side of the room and others go to the other side of the room. We approach and engage. You know, even in trauma-informed, where people need an effective intervention, that's true. But does the intervention start with the voices of the people that are closest to the challenge? And that's why community health workers are so important, because some people may not be comfortable talking to any people, but community health workers or community-based organizations or grassroots versus grass tops are in the trenches. And how can they be most effectively engaged? We all. I'm sure you've seen this. Equality, then, is giving everybody the same thing. This is an intervention. And so I'm giving you the intervention because science says that it works. But is the intervention that I'm offering one that really impacts you personally? Or is it something that's been researched without the voices of the community? And therefore, I'm going to make it fit. I'm going to make it fit. Where equity says, wherever you are resilient. Wherever you are, there's something right with you. And so the intervention that's selected is tailor-made, it's comfortable, it fits. This busy slide shows examples of stakeholders that are included. And then there are external stakeholders, which may be researchers or academic partners. And then as we travel along in this bus together towards success, each stakeholder from wherever they come is contributing and being supportive so that when we reach our destination, success, true and sustainable success, is truly achieved. One way of better understanding the partnership is seeing inner stakeholders or grassroots folks like me, I'm a grassroots folk, as bringing real life experiences to the table, and external stakeholders as providers of scientific and academic research that support those experiences. Collective impact and sustainable change. Common agenda. We need to have a common agenda. And this is what collective impact really talks about. With collective impact, the common goals of the coalition, collaborative, the people that are joining together, are addressed from diverse perspectives. Different stakeholders bring different experiences and ways in which a goal can be achieved. The diversity in approaches and experiences have the potential to create greater impact and outcomes for all involved. So that's the idea around collective impact. Common agenda. Each stakeholder has a shared understanding of the desired outcomes and is committed to achieving them. So this is not siloed. Everyone agrees. And there are no individuals who are out for their own thing. You can do your own thing when you're out there with your own thing. But if there's something that we want to address, whatever it is, then to address it together, our agenda must be common. Shared measurement. Each stakeholder understands how to keep track of and report the outcomes of their work. When you saw the different circles with youth, parents, law enforcement, health, people who are involved in health, community members, members of the faith community, each stakeholder has a unique gift and talent that they bring to the table. And they shouldn't be forced to compete or to feel like their stakeholder group is less than another. This is how we operate in Together for Resilient Youth. And why is it youth? Because we work with adults, because the adults need to be whole in order to surround our future, the children, so that they can grow up in a better world than perhaps we are experiencing. Mutually enforcing or reinforcing activities. Each stakeholder uses their agreed upon skill set to achieve the desired outcome, enabling diverse ways to offer service and achieve success. So you're getting the picture, right? So when we come together around collective impact, the commonness that we have, what we have in common, is that common agenda. What are we addressing? And yes, I can use you. Yes, a youth has a voice. Yes, a parent has a voice. Yes, a retired person has a voice. Everyone has a voice. And then in continuous communication, it's exactly what it says, right? All stakeholders stay engaged on the road to success, building trust and ensuring individual and collective goals are being achieved, right? So, and we constantly look at what we're doing to see, is this working? And if it's not, that's not the worst thing in the world. We go back and say, we need to make an adjustment here. On the road to success, building trust and ensuring individual collective goals are being achieved so that collective motivation and accountability is achieved. So how can we do these hard elephant in the room kinds of things? We can do them when we agree together on what we will do. We are builders, the builders, who are building a world that has never been built before. And my last slide is about Ubuntu. And what that says is that there was an archaeologist that was leaving the town that he had been working in. And so he bought a big basket of fruit and set it way down at the end by a tree. And he said to the children that were gathered around, whoever gets to the tree first will get the whole basket of fruit. So when I say 1, 2, 3, run to the tree and get your fruit. 1, 2, 3, they joined hands and they ran together. They sat down under the tree and enjoyed the fruit together. The archaeologist asked the question, why did not one of you try to run to the tree yourself? You could have had all the fruit. And one little girl looked up at him and said, how can one of us be happy and the rest of us be sad? Ubuntu, joining together, being in community and being in partnership, getting a handle on those hard, leading, emergent challenges. We can do it. Thank you so much.
Thank you, Dr. Boone, for that informative and even inspiring presentation. We certainly appreciate your expertise and your years of service and work in this area. We're going to move on now to our panel discussion for the morning. And I'm going to start by introducing our panelists for the morning and saying just a bit about the coalitions and the partnerships that our panelists are part of. To begin with, we have Dr. Julius Wilder, Assistant Professor of Medicine at the Duke University School of Medicine, Dr. Angeloe Burch, Executive Director of the African American Community Collaborative, and they are here representing AACT Plus. AACT Plus, the African American COVID-19 Task Force Plus, is a coalition committed to mitigating the impact of COVID-19 on the health of African Americans and marginalized communities. For the past 2 years, AACT Plus has focused on addressing equity in research, social justice, and the elimination of racism in health. They have served as a conduit for sharing information, trusted information, and an advocate for equitable vaccinations and testings. Their researchers, community health workers, clinicians, community-based organization leaders, school personnel, public health experts, and faith leaders have been at the forefront of the nation's fight against COVID-19 since its formation in June of 2020. Welcome, Dr. Wilder and Dr. Burch. Next, we have Camryn Amspacher and Dr. Liz DeMattia. Camryn is founding director of the Core Sound Waterfowl Museum and Heritage Center. And Dr. DeMattia is director and founder of the Community Science Initiative at the Duke University Marine Lab. So the Coastal Climate Resiliency, the Core Sound Waterfowl Museum and Heritage Center and the Duke University Marine Lab have worked together over time to build trust and forge a lasting collaboration. Their joint efforts include development projects, environmental education, community service, research, and disaster relief, and more. And our third group, our panelists are Dr. Edgar, Vergara, Millan, pastor and executive director of Ecclesia La Semilla, Dr. Irene Feldsman, who's assistant clinical professor of the Duke School of Nursing. They are representing Latin 19. So Latin 19 is a multi-sector group of over 700 participants representing academic institutions, healthcare systems, public health departments, public school systems, community-based organizations, government, faith communities, and others. The coalition was established by clinicians at Duke University to address health disparities within the Latinx community as a result of the COVID-19 pandemic. They provide a critical space for leaders and allies of the Latinx community in North Carolina to create collaborative and interdisciplinary solutions in a trusting and committed environment. So first, I want to say welcome to all of our panelists this morning. We're going to begin with a brief presentation from each group, and afterwards we'll come back with the panel discussion.
Sabrena, do you want me to go ahead and begin with ACT Plus?
We can start with ACT Plus, yes.
Sure, great. Well, thank you so much. Dr. Boone, that was a fantastic talk. I love the tree. I love jazz, and my one of the favorite groups from Baltimore is a group called Fertile Ground, and they have a song called "What About the Leaves on Trees, Broken Branches?" And I think that your talk, speaking to the roots, really sort of spoke to me. So thank you so much for that wonderful presentation. And I think ACT Plus and all the other wonderful groups that are here really sort of speak to what you're defining here in terms of us coming together as a community to address these issues. I have a few slides about ACT Plus that I will share. Let me get this out of the way so everyone can see it. Hopefully you can see my screen okay. And just a few slides sort of highlighting who ACT Plus is. This is a group that was organized in a partnership with the community in Duke. The idea being initially to advance health equity and mitigate the impact of structural racism and the social barriers heightened by COVID-19. We were all aware of the impact of COVID-19, globally, of course, and certainly with the United States, but we were also, of course, saw what COVID-19 did specifically to communities of color. And so ACT Plus was organized, created to begin to address some of those issues. And I'll say, and Dr. Burch, please chime in, if you want to at any point in time, but like this has really grown to something that's going to be going beyond just ACT Plus. The vision being to have mobilized communities that are enabled to support positive, sustainable change and improve health equity. And so while ACT Plus was initially created to speak to an important issue, a timely issue with respect to the pandemic, it really is continued to be very active and grow to have an impact even beyond just COVID-19. And as part of its development early on, an important piece of this was looking at the values of what ACT Plus was and its partnership with Duke and how those aligned. And how it was really important that there was clarity and transparency, that there was trust and respect, and that it was mutual as we began to think about how this important entity within the community could leverage its relationship with Duke and other entities within the community and to really be a source of improving health equity for the African American community here in Durham. And so what do we mean by that? So, many of you already know, I imagine, that every Tuesday around noon, there is a Zoom. And on this Zoom, we have numerous individuals from the community and from Duke who are engaged in this community work, come and share. And actually, it begins with the Durham Department of Public Health coming and sharing an update on what's happening with respect to the pandemic. And so we're always keeping that sort of at the forefront of our minds, understanding where we are right now in terms of things that are actively occurring. But in those meetings, there's an opportunity to be a clearinghouse, right? A place for networking where you have numerous community organizations engaged. And the idea being that we can then begin to build around outreach and education by creating this place where people can come together, where the community can come together, academic as well as the community in Durham, and even more beyond, even more broader than that. And there's a list here of the various things that can occur and that are occurring as it relates to the outreach and education in this group. But it really is sort of born out of this sort of opportunity for us to come together as a community on Tuesdays to talk about COVID-19 and then to carry conversations beyond COVID-19 and explore the many ways the various entities involved with ACT Plus can work together to improve health in the African American community. And beyond just the education piece and the clearinghouse, advocacy is really important, and this is some of the things we do here around advocacy. The idea being that we want to be an entity that is actively engaged with Duke, with our leaders within the community, so that we are speaking up social justice being something very key to us in terms of one of our priorities as an organization. And then, of course, research and funding partnerships. We, when Dr. Boone was talking about sort of the idea of building sustainable things, we want to invest and engage in research and partnerships that allows us to create an infrastructure here within Duke and Durham so that we can create sustainable impacts that are positive and significant and felt throughout the community. And so we are already engaged. We received some small grants and other larger ones that are pending, where we're looking at ways that we can partner with various entities within the community, both the research, academic, and in the community, to think about how we can create those, or that infrastructure, right, so that we can create sustainable change. In the interest of time, I'll stop there. But we're really excited to be here, and we have our opportunity to share some of the things that we're doing with all of you. I'm happy to answer any questions towards the end. And we're really thankful for the other organizations that are here that really are working with us in various ways of partnership to serve the broader Durham community and beyond even better. So thank you all again. We'll stop there. I will stop sharing and go from there.
Dr. Wilder, can you leave that up?
This one, yeah, absolutely. I can put that back for you. Absolutely, sure.
And if you don't mind, leave that up so I can look important with you.
Yeah, right. We all just want to be you, Dr. Burch. What are you talking about?
And also to say that, AACT Plus was the brainchild of Dr. Roosevelt Campbell when he was at Duke. And I think looking back at this, we understood what community engagement looked like, or what we thought it should look like. And also we recognize that, what happens when the engagement ring doesn't fit. And that's why, we needed something for our community. The engagement ring wasn't fitting, and consequently, engagement doesn't necessarily mean relationship. And so AACT Plus had to understand that in order for us to deal with our community and to marry Duke, not just be an engaging aspect, but how do we make this a marriage? How do we make this something that's going to be long-term? And find a ring that fits our community, not one that someone just picked up and thought, this is how we're going to go into the African-American community and put the ring on their finger, and now we get a preacher and they marry us. It doesn't work that way. Our community is different. It has so many different aspects and to it. And AACT Plus saw that and recognized that in order for us to help our own, we had to make some hard choices and speak to racial justice, speak to social change, because our people face things that other communities do not face. And this is just a reality. AACT Plus bought in the reality of being engaged in our community and not based upon what someone else thought that engagement should look like. How do we reach our folk? How do we speak to them and speak to their language? I keep hearing about trust and meeting people where they are. I like those statements, and I think there's something in that, but you're not meeting someone where they are if you keep trying to bust them to where you are. You need to get up and go to where they are, and that's how you meet them, and that's how we become, if you will, agents of impact. And I think Dr. Campbell saw that. Dr. Wilder has seen that, and he's been working with it, even to Kimberly Monroe, who is on this, but is not speaking. But Leatrice Martin, the people that have been behind the scenes so many times, we see the results, but we don't see what people have gone through to get us where we are. And in this engagement opportunity, or this engaging opportunity, having to hear what community has to say and then having someone to take it back to the powers that be. And that's where Sabrena Mervin-Blake has been very, very instrumental in that. And so I think when you look at this screen, you know, the network and the equitable vaccine, all of this comes out of us understanding when the engagement or the engagement ring doesn't fit. My time is done, and thank you.
Thank you, Dr. Burch and Dr. Wilder. Next, we'll go to the Coastal Climate Resiliency.
Hi, everyone. I'm going to share my screen. Let's make sure I do this correctly. Can you all see my screen? Great, thank you. Well, thank you so much for having us today. What a wonderful morning so far. So my name's Liz DeMattia, and I'm here on the coast, actually, at the Duke University Marine Lab. And I'm joined today by a voice, which is my partner, Camryn Amspacher, who is the Executive Director of the Core Sound Waterfowl Museum and Heritage Center. We are also joined in spirit by Dr. Lisa Campbell, and we'll get to that in a second. But what we're going to talk about today is this university community partnership that's been going on now for over like 15 or 16 years. And it's been going on, and it started really with these two women. Camryn Amspacher, who is on this call, on the Zoom, is to the left in green. And she is the Executive Director of the Core Sound Waterfowl Museum, and Lisa Campbell. And Dr. Lisa Campbell is Rachel Carson Distinguished Professor of Marine Affairs Policy at the Marine Lab. But more importantly, she's someone who looks at policy and looks at communities and looks at socioeconomic, and actually lives in this area and works in this area and does research in this area. And so this partnership actually started with Lisa and with Camryn on a project called Saltwater Connections that Camryn is going to describe. And these slides here, you don't have to read them, but these are examples of some of the products from it. So Camryn, will you tell us about Saltwater Connections?
Good morning, everybody. Yes, Saltwater Connections was exactly that. We were working in the footprint of the Outer Banks National Scenic Byway, which, if you've ever been to the coast, you know we've got more water than we've got land. And those of us who are from here understand that that water is what connects us. It doesn't divide us. It's our common thread, our common culture, our common environment. So the Outer Banks National Scenic Byway was a national program that brought together 17 communities from Rodanthe, which is where the houses have been falling overboard the past 2 weeks, all the way down to North River, which is east of Beaufort. And Lisa was very interested in working with us on this because of a previous effort that some Down East residents had gone through called Down East Tomorrow, trying to put a handle on large-scale development in our fishing community environment. So we spent a lot of time on the road, on a ferry, on a boat, going from community to community, just listening. And I will have to say that listening and listening carefully with Lisa has been the key and the foundation that our relationship has been built on. So that was the beginning of it. A lot of time spent, a lot of laughter, a lot of missed ferries. Like I said, we even ended up in the ditch one night together because it had rained so hard I couldn't see where the ditch ended and the road began. So, but it has been a very meaningful and rewarding for our community in the research that Lisa has helped bring to us and let us be a part of.
And I will add in there that those connections and that listening, that's at the heart of that community university partnership. Lisa is a social scientist. And so listening is part of what her lab does. but it's also part of what Camryn does at the museum, because the museum itself tells the stories of what is happening on the coast here. So that partnership, though, and the trust that Lisa and Camryn kind of created together, along with members at the Marine Lab and different lab mates, graduate students, from PhDs to master students to undergrads who worked on those projects, actually set the foundation for the work that's going now. So about 7 years ago, I moved to the Marine Lab and had a meeting with Camryn and Lisa to introduce us as I was creating this community science initiative. And that from that meeting has basically just grown partnerships and projects. So we have moved on from saltwater connections. It's still part of everything we do, but we, 2 years in, Hurricane Florence hit the coast. And what we kind of, everyone saw and lived through in that experience was there wasn't a lot of, kind of anecdotally, there wasn't a lot of outside help from the county. Where did resources go? How are people connected? And so Sea Grant actually provided funding for Lisa Campbell, myself, and for Camryn to actually do a social network analysis of what was happening after disasters. And that information, social network analysis can be very theoretical, but true to Lisa Campbell and kind of her lab's focus, as well as the community science focus and Camryn's focus, that information was funneled back to the community, because what came out of that is that the key players were fire stations, schools, and churches. And so those three that's the bedrock of what supports people after a disturbance in the coast, of which there are many. And with that, future hurricane preparedness planning has actually gone in to connect fire stations, to connect those to churches, as well as the schools explicitly, which has resulted in more communication and hopefully, knock on wood, if we have another big storm like Hurricane Florence, better outputs. But it didn't stop there. Other social scientists at the Marine Lab, Grant Murray has been doing fisheries and aquaculture work with Camryn and with local communities here. Community Science Initiative, we have service projects, we have undergrads doing documentaries for and with the museum. We have master's students who are doing discourse analysis that can end up, and our products, even though they can be theoretical, we try and always merge products back into what's needed at local museums and for the local communities. Documentaries, as well as just plain service projects where we have high school students working alongside our university students to do mentoring in the summer outreach with kids. I focus this picture or this slide on the people because it's the people that actually have made these connections possible. And these two pictures here are pictures after Hurricane Florence. So to the left, you see just a mountain of garbage bags, and that's the inside of the museum, which was completely gutted by Hurricane Florence. And to the right, you see the inside of one of our churches, which was completely gutted. And I'll let Camryn, I'll stop talking for a second because I know you have something to say about these two.
Yes, we believe, somebody said, and I'm taking it as a sign, that down east, and when I say down east, I'm not talking Raleigh, Rocky Mount, LaGrange, or Kinston. Down east is truly east of Beaufort, 13 formerly fishing communities. And we have our own culture, our own way of thinking, our own issues, and our own challenges. But Florence gave us a heavy load to carry, and the museum, yes, was gutted. And when we say museum in the traditional terms is just a piece of the work that we do. We're very much focused on what goes on in our community. So we're more of a community network, really. But part of what we do best when things are at their worst is work. I mean, and I appreciate that Lisa and Liz and Grant and all the folks at Duke Lab and the people, even students they brought from Durham campus, they came and helped muck out buildings. We had this church on the right is Free Will Baptist Church at Davis, and one of the matriarchs died right in the middle of this. I mean, we were without power 10 days. We didn't have ice. We didn't have anything. And this matriarch of that church died, and her family wanted that funeral in that church. No electricity, and it had been flooded. It had 8-10 inches of mud in it. And so the community came together, and I remember Grant and a gang of students came, and they, with generators and fans, they dried that church out, ripped out the carpet, moved all the pews, put it back so that this lady could have her funeral in that church. And for an academic, for an academic institution like Duke University to understand that level of community passion and history and heritage was a turning point. And, I think we have learned over the years that we are all just human beings, that we do different things in this world and we have different roles, but that we are better together. And I do believe that Duke Lab, it hasn't always been that way. Lisa came into the project with the understanding that Duke Lab was often on the environmental side of fisheries issues and community issues, but there have been a lot of bridges built across that concept, and we through work and people connections, we have been able to build a partnership that I believe has opened eyes at the academic level, but has also opened eyes at the community level, that at the end of the day, we're still human beings.
And at the end of the day, we are at the forefront of a rising sea, and the Down East communities are really in that area. We have some resilience projects currently working with them, but I think that the other key for this group is people, but it's also shared experiences. We all live and work, our kids go to school together, our family members can be at the same churches, sports teams, bands. And so that type of connection builds trust. And so when we talk about why we have been successfully working together, I think it's the humans and the trust and our community connections. And I'll stop there and hopefully let you think about the sunset as you go into the next presentation.
Thank you. What a beautiful, beautiful space to have our minds on the sunset. So next, Dr. Feldsman and Pastor Edgar.
Well, those are hard presentations to follow. Beautiful, all of them. And thank you for having us. We are, I'll just move on through the slides here if I can get them to move. Always a challenge with Zoom. There we go. So I just wanted to give a general overview of what Latin 19 is and recognize Reverend Edgar Vergara as one of our primary partners. As you can see, I've starred La Semilla here. We started working together, Latin 19, as a multi-sector group back when the pandemic first reared its ugly head. And we are Latin 19, representative of many groups, which you can see here, and I won't read those off. We have over 1,000 registered participants in our Latin 19 coalition who participate in various ways. So I'll just, without further ado, move on there. And Edgar, do you want to say a little bit about who La Semilla is?
Yes, thank you, Irene. Good morning, everyone. My name is Edgar Vergara Millan. I'm the pastor and executive director of Iglesia La Semilla. Iglesia La Semilla is a co-vocational faith community of the North Carolina Conference of the United Methodist Church. Our focus is providing accompaniment and support for Hispanic, Latino, Latina, Latinx communities in the Triangle region, Durham, Raleigh, Chapel Hill, and surrounding rural areas. We focus on tending to providing support for our communities in the areas of justice, education, and health. We have been heavily or deeply invested in pandemic response ministry and community health work since early on in the pandemic with social support and food assistance, and towards the fall of 2020 with community health workers deployed to serve our communities.
Thank you, Edgar. So the focus of our partnership together is basically to address disparities in the Latinx community or Latino or Latina community that have been exacerbated by COVID-19, and also longer term goals, as AACT Plus discussed, to promote overall health and wellness for diverse Latinx communities. And I might give a disclaimer that Latinx is a term that's really used in academic circles and not generally by the Latino-Latina population. So who's involved in this? On the Latin 19 side, we have a leadership team that was begun by Dr. Viviana Bianchi, Martinez-Bianchi and her colleague, and then joined by others from the School of Nursing, from the community, from Duke Psychiatry, et cetera. So there's a team of 8 of us that lead the initiatives, but we're really a coalition of many, many different organizations that I showed you on that first slide. We have a lot of volunteer clinicians that work with us and a lot of community organizations as well. And on the La Semilla side, there's a community health worker coordinating team, a church leadership team, many, many community volunteers, partner agencies, CBOs, congregations, and organizations. Just see the extent of all the work we do. So we thought we'd talk a little bit about strategies that we use for effective change. And we, again, started back in the very beginning of COVID-19 when it emerged as an issue. We convened a lot of Duke health clinicians and community partners together, looked at how the Latino population was disproportionately affected, as well as all other BIPOC communities, and AACT Plus already discussed that. There was unequal access to testing, other resources, high-risk work environments, crowded living conditions, et cetera, which many of you are probably already familiar with. So what we do with Latin 19 is we have weekly convenings of these community partners to discuss issues and where we might engage with the community to make changes and to intervene. Many of the things we've done are vaccine events, education events, sending out media messages, working with Duke Health to get information rolled out in Spanish, working to provide resources for vaccine rollout and testing. And right now we're working on sustainable long-term collaborative partnerships across the community. But I think we're going to focus today a little bit more on the work of Latin 19 and La Semilla together. So what we like to think about is a sort of bi-directional collaboration, and many of you have talked about that as well today, how important it is to listen and to communicate with each other and not just make decisions about what we think as a health system is good for the community, but rather doing this in collaboration. So here's a few strategies that we're focused on with Latin 19, which also are inclusive of work with CBOs, looking at, again, our convenings, our interdisciplinary convenings. We do mobile testing events, and we work on vaccine equity for our communities. We're now working, we just received a KBR grant to work on health insurance information and rolling that out for our community. We have mental health initiatives. We do community-based participatory research. We have several on our team that are community researchers. We have had support groups, and we work with community health workers and navigators in doing capacity building and training. And a lot of the work that we do is advocacy at the community level, at the health system level, and also at the state level. We have a program for youth ambassadors where we help them roll out information about COVID to the general community and their own peers. And then we also work on health literacy for others in the community and patient safety. So it's a little, just a sort of overview of the kind of work that we've done. Some of the challenges that we've faced have been the historical mistrust of health systems and the lack of adequate education materials in Spanish. So we've worked to get My Chart in Spanish. One of our clinicians at Duke, Leonor Corsino, has worked very hard to do that, and it's now rolled out in Spanish. Misinformation spreading through social media has been a real challenge for us. We've tried to combat that by using social media ourselves with positive information, and for all different levels, from youth all the way through adults, radio stations and videos that we put on social media. There's a lack of access to care once people are actually found COVID positive, and in other instances as well. A lot of volunteer fatigue, which I'm sure all of you have felt as well throughout this pandemic. Overextension of hours from all levels, from the Duke side all the way through the community side. Maintaining sustainable partnerships is a challenge, although we've done quite well at that through listening and communication. And we really work hard at not overstepping community-based organization authority and working with them to make decisions and reflect our programming based on what the needs of the community are. And the other thing that we can probably all relate to is that we compete for limited funding to support our activities. So it's very important to continue these discussions with whatever organizations are working to better the community. What are you doing? How can we support you? And how can we not compete, but actually work together? So I'm going to give a few examples of some of the challenges that we faced in the very beginning. And this is a map of where testing sites were found in the very beginning of COVID. And you can see on the left-hand side that the testing sites were in the wealthier areas of Durham. So one of the things that we did was work very hard to get testing sites in areas here in Holton and Lincoln Community Health Center and other areas of Durham, like Wheels Fun Park, and that so that they were more accessible to our population or to marginalized populations. Okay, another thing that's an example is we have provided vaccination events in trusted spaces with trusted partners. And we're talking about La Semilla, El Centro Hispano, and other community-based organizations. But La Semilla has been incredibly supportive and instrumental in getting vaccination events out into the community, and particularly with community health workers. And I'm going to let Edgar talk a little bit more about that. This is just an example on the left-hand side of when Latin 19 and La Semilla and other organizations are involved in vaccination events, what happens. So you can see that in the events where Latin 19 and community-based organizations were involved, giving Spanish language support, many more Latinos were vaccinated in those events here. You can see.
Yes, thank you. That data is quite worthy of celebration. Well, it is an honor for us in a very welcome, breath of fresh air to have the support of Latin 19 and Duke Health through Latin 19. Our community health workers have received training, accompaniment, support through our partnership, and that has made a world of a difference. You'll see a few quotes directly from them in a few moments. But that has been a game changer for the way in which we engage and serve our Hispanic, Latino, Latina, Latinx communities in the regions that we have served. It makes a difference having access to expert healthcare professional opinions, advice, feedback. Our community health workers are members of the communities that we serve. They are not coming from outside of the communities, but they are members of those communities. Hence, they have the trust the ears and the hearts of the community, you know. And so they themselves serve as the ears of the community to healthcare professionals that we collaborate with. And it does make a difference when a community health worker can reach out to one of our Lat-19 partners with a specific question or with a specific need and have a very quick response that then they can relate to community members almost immediately. That's definitely been a gift. An example of the trainings that we have received through our partnership is something that's worth highlighting, is the training that our community health workers received to perform COVID-19 tests. It really was a game changer when you were showing a map of where testing was available, but it really made a difference when community health workers themselves had the training necessary to perform the tests. In the same way that community health workers have the trust of the community, it was quite wonderful to see the response, especially at the height of the Omicron variant, when so many tests were needed right around the Christmas holidays. We were doing an average of 70 tests per 4-hour session. But it did make a difference for our community members to come out to have a test done by someone they knew, someone they trusted, someone they could easily approach without any fear. And so that was wonderful. And that also gives us an opportunity to highlight the wonderful access that we have to resources, in this case tests, COVID-19 tests, and also just the structure to report test results to the state, et cetera, through this partnership. And so that's something that's definitely worth highlighting. For us, what I'll say lastly is that having the opportunity to integrate resources to support our community, food assistance, social support, rent utility assistance with health-related resources, reliable information that is communicated in a way that guarantees that it will be well received by the community, that is backed by our healthcare professional partners, has definitely been an important vehicle to increase vaccination in our community. For us, bringing vaccines to where people live at times that are convenient for them. For example, our community vaccination events on Friday evenings from 4 p.m. to 8 p.m. It makes a difference for community members when the vaccine is right outside your door. And even when your neighbor is getting a vaccine, and when your neighbor's children start getting a vaccine, then you're sort of nudged to do it yourself as well. And we keep seeing, incredibly so, continue to see first doses at these community events, which tells us that we're on the right track. We'll share a few quotes directly from our community health workers. This comes from Yadira Lara. Yadira is one of our community health workers, recently certified as a community health worker through Durham Tech Community College. And this is on the support that we received from Duke and Duke Health and Lat-19. So let me read for you. Yadira says, having the support, training, and resources provided by Duke Health and Lat-19 has made me feel confident as I share information with our community backed by healthcare professionals. It has made me feel that I have the capacity to advise my community and feel at peace by knowing that they provide the resources that our community needs. This one is from Beatriz Meraz, another of our community health workers, also recently certified. And this is on integrating resources, food assistance, social support, health-related resources as we serve our community. And Beatriz says, having the opportunity to provide food assistance and social support has had a great impact in the Hispanic, Latino, Latina, Latinx community, greatly benefiting it since it has been one of the communities that has been most severely affected during the pandemic. It allowed us to provide information from credible and safe sources regarding COVID-19 prevention and vaccination, allowing our community to remain strong and stay healthy. And this one comes from Jackie Hernandez, one of our coordinating team members. and she's also a community health worker recently certified through Durham Tech. And she's speaking regarding the support provided by Iglesia La Semilla and the North Carolina Conference of the UMC. Having the support of Iglesia La Semilla and the NC Conference has been a great blessing during the most difficult times for humanity. And it has allowed us to serve our community by offering education, support, hope, compassion, vaccines, and saving lives.
Mhm. Yeah. So we want to thank you for listening to our presentation. These are just a few photographs of our teams. This is the Latin 19 team up in the top left corner, the leadership team, and Edgar, of course. And this is a wonderful photograph of the graduation. Edgar, do you want to talk about that a little bit? Last Sunday's celebration?
Yes, no, we continue to celebrate our community health workers that have been certified. They had their virtual graduation from Durham Tech last night, actually. This photo comes from the recognition ceremony that was put together by Duke Regional Hospital in Latin 19. So a wonderful, momentous occasion. That is half of our team who have been now certified. And we are encouraging the rest of our team to seek certification in the coming semester. So again, a word of gratitude to Duke Regional and Duke Health in 919 for the ceremony, but most of all for the collaboration and the continued support.
Yeah. So you can see that we very much appreciate each other as community partners and look forward to a long relationship to try and change and work towards advancing health equity in our community. And we so much appreciate the amount of work and energy and passion that goes into this work from the community side. So I want to just give a public thank you to you, Edgar, for everything that you do. Yeah, so I think we'll end there. And I know there's a question and answer as well. So, thank you, everyone.
Thank you.
Thank you to each of the organizations, coalitions, partnerships for your introduction of the work that you've been doing. We're going to now start our panel discussion, and I will pose a few questions, and there's some activity going on in the chat as well. So we'd like to take a question or two from the attendees. So if there are questions that you'd like to ask as well, you can feel free to put them in the chat, and we'll try and get to as many as we can. So I want to start the panel off with a question. Most of you in your presentations already mentioned how you have come together as partners in the work. And some of you have even talked about how you activated the community-based work, but I want to pose that question for those who may not have had a chance to discuss that. So the initial question is, how do you activate community-based work in the midst of an emergent or urgent situation, whether it was COVID-19 or whether it is some coastal emergency? So that's the first question, and I'll start with AACT Plus representatives, Julius and Dr. Burch. How do you activate community-based work in the midst of such an urgent situations?
I can start off. You know, I think the key thing about activating the community in these types of scenarios is engaging the community. I mean, it sounds very silly, but I think that a key piece of this is taking the time to understand what the community needs are. And I think if you look at all the different groups here, it began with engaging the community to contextualize and properly understand what were the issues as it pertained, for instance, here to the pandemic. What did the community feel was the main issues that things needed to be prioritized? And then ensuring that as you came to a solution about what that activation looked like, you allow them to direct you with respect to what resources were needed, how much resources were needed, and how to best sort of mobilize those resources and embed them into the community. I think that helps ensure that the community is getting what it needs in terms of, in this case, the COVID-19 pandemic, as well as build an infrastructure that is going to be something that's going to be more sustainable over time within the community.
Dr. Burch, you have any additional comments? And I want to add to that. What were some of the challenges of starting the activating the community?
I think getting people to understand that making the relationships or working these relationships, that there would be some solidity to what we were trying to do, that it just wasn't going to be an overnight thing. Excuse me. Getting people to understand that, you know, this wasn't a one-shot deal, and it was going to take all of us working together and coming and just being open and honest with what we needed in our community, then speaking to those that could provide other resources. And then that's my short answer. I'm not going to belabor it.
Thank you. Dr. Liz or Karen, any thoughts as well? How did you activate community-based work in the midst of Emergent?
Well, it's kind of old school in terms of phone. After Hurricane Florence, we didn't, you know, there was very little cell. So I'm giving a specific example here, very little cell, but it was Karen texting me and Lisa, and it was like, okay, this is what this community needs, connecting to a different area, and then using people. We talk about social connections and social network analysis is you have your, you know, your inner circle, but what makes a community resilient is actually connections to people out of your resilient inner circle. And so having connections to people outside of your small community. So for example, the Methodist Church had connections to Raleigh and Durham. That brought huge resources into our community because it was 1 or 2 steps removed. And so that network of connection actually gets mobilized in times of need, whether it's flooding, a hurricane, COVID-19. But it starts with, and I think this is what, you know, Lot 19 was talking about, it starts with trust. Trust between people who work together. Karen, what else would you say?
And I would say that it takes internal leadership. You know, my community is very void of leadership. It's because leadership means you put your house damage on hold while you deal with somebody else's house damage or food or needs or whatever. In fact, my house still is not fully repaired from Florence, and it's been 4 years. But that's okay, because you got to have people who are on the ground and hearing. You know, social media was a very big part of our whole Florence response. It was like the first hurricane that really had Facebook and Instagram and all those places. I didn't have cell signal. I had to drive 6 or 8 miles to get cell signal while my truck was running so I could keep my phone charged because we didn't have power. But just having that internal leadership connection, you know, the museum, you know, we had a network of thousands on email, and I would send text to Lisa and Liz. I also had people in Raleigh who were converting those to messages. So our network had full communication on the ground, not where TV is. And I will say this too, you know, for rural communities, truly rural communities, you have to develop your own network, because the TV crews are going to go where it's more visible, where there's more people, where there's more knowledge of those communities. So small communities often get left out when you're depending on news media to cover a tragedy. So you just have to be engaged and constantly. And you can't just pull in and pull out when you want to or when the weather's pretty. You got to be there through all the days and hard nights.
Great, thank you. Dr. Feldsman and Pastor Edgar, you guys talked about that a little bit, but would you like to comment as well?
Yeah, I would like to add that we didn't start engaging with the community at the start of the COVID-19 pandemic, but we had long-term relationships already, which I think Liz has referred to as well. So we built on those long-term relationships by connecting again around this particular issue. Particularly at the School of Nursing, we have students placed in the community at least 12 different sites that we work with partners throughout. We've been working with partners for over 15 years. So we call on those relationships, we talk with people, and then we listen to what the needs are around particular crises issues as well. So I think that's what it is. It's sort of long-term sustainable relationships rather than like Karen was saying, dipping in and dipping out, but really caring about the people that we're working with and really caring to listen as well. Edgar, did you have something you wanted to add to that?
Muted.
2 years of Zoom meetings, I keep doing that. Yes, for us, it's acknowledging the self-empowerment of our community, acknowledging that the community is already active, responding to a crisis situation, and then connecting to those community members and groups that are already active in responding. In the case of our partnership, I think it's a wonderful example of fixed points within our communities, the health system, the church, that are constant points in our community's landscape, and connecting resources of the health system and resources of the church to those community members that are doing the work with very limited resources. And so our partnership is a wonderful example of providing the resources that are needed for that activity and that self-empowerment to be uplifted and expanded.
Great, thank you, thank you. Next question that I like to pose you is, you talked about, of course, the importance of the partnerships. How do you manage and navigate when either the differences in priorities or cultures or timelines come to bear on doing the work? And can you offer some examples of how your partnership navigated the differences, particularly probably the differences in priorities, maybe in timing, and culture as well? I think for each organization it could be a little bit different. And I'll let whoever would like to start with.
Sabrena, I'll jump out first on that. I think it becomes taking a negative and finding a way to turn it into a positive. We all have our dealings with certain entities. We all have our dealings, and we have a history, and it becomes understanding when we throw this word around: community. Community is diverse. The African American community is diverse. The Latino community is diverse. And so, sometimes the powers that be, and I'm not going to name names, and I know that's a shock to most of you that know me on this call. I'm not going to name names, but sometimes the powers that be get used to working with certain people and certain individuals in certain communities without understanding that there's another community that's really hurting, and they may not have someone to stand up and speak for what they need. And so you marry those things, and you try to get those people that can get to the ones that you need to get to, and everyone singing off the same sheet of music or singing out the same hymnal, but understanding that, when we say community, it doesn't cover everything. That's just not an end-all word. Community is diverse. And if we don't understand that and get that in line, then we're not going to get anything done. And coming with our churches, even churches have different viewpoints of how things are done in the community. I love my air quotes there. But the thing of it is that we had to step back and say, how do we get everyone involved, and understanding that the people that we need to reach are not on these Zoom calls. people we need to reach are not in our meetings. Those are the ones that are hurting because they don't have the resources and they're depending upon us to speak for them and speak to them in a manner that's consistent with what they're going through and not what we think they're going through. I'm done.
Thank you. Anyone else? Jump in.
I can go. This will build on what Dr. Burch was talking about, in that we have areas that are rural areas, and there might be 13 unincorporated communities, but each one of those is different, and those are as different from. And yet, what we have found, all of those areas, one of the few places where all of those areas actually connect are within our schools. And so some of our work has actually been done in our schools, and with this idea of intergenerational transfer, how kids can talk about issues and work on issues with parents in ways that scientists can't, church leaders can't, but can break down barriers and actually break down any some of the political divides on environmental issues, especially in areas on the coast where we're dealing with recurrent flooding and rising sea level and climate change. Kids have a way of engaging. And so some of our actual engagement work has now shifted on our resiliency side into schools where all kids are working at, as well as with after school communities where we have kids from many different areas coming together. So trying to find areas that are less based on religion or family or geography, and more on a public entity that's catchment, that's open to all. Karen, is there anything else you'd add?
I would say, again, going back to the common themes here, fisheries issues are, even though a family may at this point in their generational families depend on commercial fishing for their income or their livelihood, it's still a very common cultural thread and has been threatened for years and years. And so a lot of our networking has been on fisheries issues, and that's a hard group to handle because they are very much wounded for years and years with policy issues, and they often associate academics with policy issues. So you have to understand sometimes the history that causes people to be reluctant or untrusting of outside forces. The Chinese communities are going through lots of crisis right now, from economic, the pandemic has pushed tons of second homeowners to become full-time residents. Population is growing. People moving in are a different economic group, they're a different political group. So there's lots of stress on the community from a cultural standpoint, as well as the environmental and economic. So, we got shrimpers this summer who are saying they're not going to be able to shrimp because of the price of gas. So what are they going to do for a living? So you got to be conscious of that not everybody can worry about tomorrow because they're too worried about today. And so, it's complicated. It's very complicated and it changes quickly.
Thank you. Reverend Edgar, you have your hand up?
Yes, thank you. I want to bring our attention to Dr. Angelo's point he made earlier, that many in the communities that we are seeking to serve in the midst of situations of crisis, such as the ones that we're highlighting here, are not in our Zoom calls and are not included in the conversations or the table where decisions are made, etc. And that's definitely a very real situation. But I want to just mention that the importance of the fact that our communities have their own voice, and that we are not the voice of the voiceless. I speak for myself in the ministry, in the church. Our role is to uplift and amplify the voice of the community, and to Dr. Liz also mentioned barriers. Part of our work is transforming those barriers into bridges, that can then lead community members that are resilient and that are doing wonderful work that's responsive to these crisis situations, to come to the table and not only be included in the conversation, but lead the conversation to ensure that they have access to resources that are needed, again, for self-empowerment.
I might add that to that, Edgar, that one of the things that's been the most, should I say, most poignant for me during the pandemic is working directly with community health workers who are working directly with people who don't have a voice at the table. And I have tremendous respect for them. They've been able to inform our work, to set us straight when we're not getting things right, and just demand a level of respect that that they should have. And I just want to say that out loud. And I hope that we will take those lessons and carry them forth in whatever work we do toward health equity in the community and social equity, and not forget about that in our busy academic lives and other lives as well. That it's just so important to just listen to people, to share perspectives, and to respect each other's, as you said, Sabrena, timelines and agendas. So.
Great, thank you. Just wanted to remind the audience, if you have a question that you'd like to ask, feel free to put that in the chat as well. We have time for a couple more questions. I'll just pose another question here around, since we're talking about partnerships between institutions or universities and community. Again, in these emergent or urgent situations, in what ways has your partnership needed to shift or change?
Can you repeat that? I don't know if other people heard it, but I had a hard time hearing the question.
In what ways has your partnership needed to shift or change? Among these emergent, urgent situations. Any thoughts? I can pass it on to Dr. Julius.
Sure. Yeah, I was going to listen to chance, but yeah, I think that we in AACT Plus have had to shift a number of different ways. You know, and again, this goes to the point that was made earlier around understanding what the needs of the community are. And so, you know, early on, the issue was around testing, for instance, in the setting of COVID, and understanding, you know, from the community, what were the barriers and issues around appropriate testing, and identifying those places where testing was not being done, and then sort of working with the community to build, you know, opportunities for testing to be done in those communities. And then as we kind of got the vaccine, there were really a couple things to navigate, right? There was issues around hesitancy. There was issues around sort of coordinating an infrastructure to get vaccines to certain populations and to certain neighborhoods, and the best way to sort of bridge the gaps around knowledge and acceptance and trust around vaccination and so forth. And so we couldn't just really jump into vaccines. Really had to sort of think about how to engage the community, and again, work with them so that when we began to do the vaccination clinics, we were doing it in a way that the community was comfortable and was trusting. And so, you know, I don't want to take up all the time, but I think, you know, COVID, the way it's moved is a great example of how you have to be nimble, you have to be responsive to the community and be prepared to pivot as the needs change over time. And here we're just talking about the pandemic, but this could be the same. I mean, this AACT Plus is going to be pivoting to a number of health issues outside of you know, COVID-19 as well, as we think about what are other ways we can, as we identify new needs in the community, what are other things that we can do to address those needs. But I think, you know, COVID is really interesting because of the dynamics of the pandemic and how things have shifted over time, from testing to vaccination, back to testing. And sort of now we've been thinking about, you know, what does vaccination mean moving forward, and boosters and so forth and so on.
Thank you. Pastor Edgar?
Yeah, thank you. Along those lines, an important shift for us, again, highlighting the partnership effort, was at the early point or well, midpoint of the pandemic, I would say, of that first year of the pandemic, we were having a hard time referring community members to testing sites. There was mistrust, fear to go to a site that people were not familiar with. So when the shift was made to train our community health workers, again, through Line 19 support, Duke Health support, and then connecting us to resources of receiving tests, actual tests, rapid tests, and PCR tests, and providing the structure for us to report test results to the health department, et cetera. That was an important shift. I believe our community health workers have themselves done over 2,000 tests as a result of that shift. So again, the bulk of those were at the height of the Omicron variant. So that's something we definitely celebrate.
Thank you. Anyone else? There's a question in the chat we're going to come back to in just a second. Any other thoughts or comments about how your partnership needed to change among the emergent issues?
I think it changes by being willing to understand what you don't know and what you don't have capacity for, but finding other community partners or other professional partners or wherever that can bring in extra resources, and whether that's human capital or intellectual or physical resources, just A, listening, and B, understanding strengths and weaknesses allow kind of groups to shift and help finding, okay, I don't have that answer, I can't do that, but we can work together to find something that's completely outside of a certain wheelhouse. And some of our resiliency work came up because community partners said to us, we don't care about X, Y, and Z, we need help on these resilience issues. And that was, okay, well, we're going to shift into some ACEs and trauma, like climate induced, and how do we work in schools with that and connect it to nature, since we are a marine lab. But completely new that came out of COVID, because kids had social emotional barriers and deficits that teachers and schools and churches couldn't overcome. So how do we bring that? And I have to say, in our community, they just passed huge spending, like a very conservative rural community, huge spending to bring in more mental health professionals for the schools, which has come out from people talking about these issues that wouldn't normally talk about it.
Great, thank you. Thank you. There's a question in the chat that Dr. Feldsman, you're going to respond to, talking a little bit more about promoting the professional development of community health workers.
Yeah, that's a great question. We started out, of course, in the crisis by doing training of community health workers on PPE and hand washing and prevention, and then started doing some training on how to actually provide testing. And the group of CHWs is so confident and competent in all of this. They've been asking for more training, actually. So what we have added on, there was a small group of 10 that I worked with another clinician on, training them in stress and resilience and how to do motivational interviewing with individuals around, not just around the COVID crisis stress, but also on general stress. So that's one training that we've done. And other things that have been added in are actually a mental health training in general, stress first aid, trauma-informed care. There's been modules also done on how to respond to cardiac issues and hypertension in the community. So the training is building, and the CHWs are actually driving this by asking for more and by demonstrating how competent they are. So I think the push, just to be careful, the push is not to make all of these CHWs become nurses and doctors and other clinicians, but to become confident in their roles and to stay in the community and serve their communities as they wish to do and as they see the needs. And Edgar, I don't know if you have more to add to that.
Thank you. No, very quickly, this is another example of the bi-directional relationship partnership. Many of the training opportunities and modules were a direct response to needs that our community health workers identified while serving the community. An example of that is mental health. And so I just wanted to emphasize that bidirectionality is very important.
Thanks so much. I'm going to give, again, encourage anyone to put questions in the chat if you have any, but I want to ask each group, now that you're giving great examples and spoke about your work and partnerships, and even Dr. Julius mentioned for AACT Plus moving beyond COVID even to some other area of focus for the community. How will each of you sustain the partnerships and sustain the activation of the partnerships over time? And why don't I start with, I'll start with Lat 19.
Oh, you surprised me. Yeah, we actually talk about this a lot, particularly as I mentioned, one of the challenges was being overworked and by volunteerism. And I think we've all felt that here. I don't think I'm speaking out of turn, but so we're talking about how we do that in a way that's sustainable, continue to do our work. And one of the things we've done is gone after grant funding to try and support some of the work we've done. Grant funding from both sides, for the community partners as well as for the Duke clinicians and those who are involved. And another thing that we have done in Lat 19 is we've created a 501c3 from Lat 19. So we have two entities right now, a 501c3 that's just been just coming up now for approval, as well as the Duke side Lat 19. And they'll have two separate roles. One will be to continue the convening on the Duke side of all these partners and organizations. And the Lat 19 501c3 will work more in the community through grant funding on actual projects going forward. We don't know exactly what that's going to look like because it's still in formation, but that's one of the attempts we're making to make this sustainable over time. Does that answer your question?
Mm-hmm.
I just want to quickly add that a key element in advancing towards sustainability is capacity building for community-based organizations. And that's something that we cherish and are grateful for as a result of this partnership. I just want to emphasize that it's in the same way that our community health workers are enriched and empowered to serve the community better by training and connection to resources. It is a similar situation with community-based organizations, especially ones such as Iglesia La Semilla, which is a new church start, very recent effort that requires capacity building and access to resources.
Thank you. Dr. DeMattia and Karen.
Karen, I can start and then you can pitch in. One of the things that we've done for sustaining is lots comes down to funding, obviously, but we have found that funding actually isn't a panacea, because even if you have funds, you write grants with a community group, if there's no human capacity, this kind of gets what Reverend Edgar was saying, if you don't have human capacity, then it's harder. So we're in the process now of actually hiring a community coordinator that will be actually human capital for a couple of the community partnerships. So we have, we're working on some resilience issues, but also having someone who's dedicated to an organization that actually works kind of on whatever that organization needs at that time. So actually providing some recent student graduates and fellowships as a way to help keep some work going, but also pulling in others. So recognizing that funding is great, but if you don't have anyone to fill those roles at the same time, then it's hard for any organization to be part of any programs or any research. Because even if you say you share a budget, sharing a budget for someone who's working 150% time doesn't really help. Extra money doesn't really help. Karen?
I would say sustainability continues to be determined by the relevance of the work. And if the community feels like it's being heard and the quality of the relationship, I think is what I'm after. You know, is this partnership adaptable so that as new issues come about, they can face it? You know, we're looking at hurricane season right now. And so, you know, the whole community has this undercurrent of PTSD because once the Weather Channel starts spitting out these hurricanes, everybody gets a little nervous. So, you know, in my mind, in the work that we're doing that we've carved out for this summer, that's kind of an underlying fact that we will be responsive, that we'll be ready when the storms start rolling this way. So I think relevance is important to sustainability.
Thank you. Dr. Julius and Dr. Burch, how do you sustain activation?
Yeah, I mean, I would agree with everything everyone said so far. You know, I'd say one thing that we're leveraging with ACT Plus as well, along with the things that have already been said, is this idea of creating a space where numerous community organizations can come together. You know, while we're saying ACT Plus, but we're really the community, right? There are so many organizations doing so many things. And so by creating a space where they can all come together, it creates an opportunity for us to, you know, leverage those partnerships to create important sustainable relationships and programs for the community. And of course, I keep saying this, but you know, I think that for us to do anything that's going to have impact, we've got to make sure that we're focusing on things that are what the community thinks need to be prioritized, which is why I think is the other key piece to, you know, what everyone here has been doing, right? Everyone's just talking about how they have partners and then we're listening to the community. I mean, as a researcher, you know, I have all sorts of things I want to, you know, I do GI and hepatology. So I want to talk about Hep C and I want to talk about colon cancer screening, right? All day. I can talk about those things all day, but those may not be what's important right now to the community. And so I found myself writing a grant with partners on COVID because, I mean, I'm not an ID doc, but that's what the community needed. And so we've got to be willing to make those types of pivots, listen to what the needs are, identify the appropriate partners, ensure that we have an infrastructure to support that moving forward for capacity building, and then, you know, get our hands dirty and really sort of direct ourselves to what the community thinks is key. I think that's the only way that stuff becomes successful in the short term and creates something that's going to be sustainable long term. Dr. Burch, I don't know if you
just very quickly, I think it was Karen that just made a statement about the relevancy of the work. That struck a chord with me because I think in order for us to sustain and for there to be long-term care for our community is, I'm going to say this word again, I'm wearing it out today, the powers that be have to understand that they can't be the ones that determine the relevancy. Our communities have to determine what's relevant for them. You know, it can't be UNC, it can't be Duke, it can't be Duke Regional. You know, the community has to determine what is relevant for them, and then those people that have those funds or can come in and shore up what we need in our community. We can tell them, but they can't pick and choose who they want to listen to. You know, that's a problem, is that when the powers that be determine that I don't want to listen to this person because they're a little bit more argumentative than these people over here. The reason why they're argumentative to the left is because they're trying to save folk lives. And in the midst of all that, trying to build relationships and make things strong. But I think the relevancy of work has to be determined, and the scope of work has to be determined by the people you're working with and helping, and not just by those that are looking outside looking in. And that's how that's sustainability.
Great, thank you all. I'm going to go back to the chat. There's a question it looks like I may have missed. This says, this is amazing work. Are there examples of how our educational partners are integrating what we have learned from these experiences of partnerships into our classrooms and clinical work going forward? Anyone want to respond to that? Okay, Dr.
I can start with that one because I directly integrate this information into the course I teach in community and public health. And thanks for that question, Mary Vincent. I know that came from you. And also our students in that course work with community groups. So they are, during their clinical orientation, are exposed to the work that's been done by both AACT Plus and Latin 19 and other community groups. And we talk a lot about the value of community engagement and working with community partners and how essential that is in the work that they're doing as well, and how they need to recognize the strengths of community partners and also respect that voice. So yes, we do that both in the classroom and clinically.
Great, thanks. Reverend?
Yeah, I'll quickly add, our community health workers have been invited to speak at several classes, particularly with the School of Nursing at Duke University. And we are about to begin in the coming days, actually, towards the end of this month, an interlingual exchange. And so nursing students will join community health workers for 3 sessions during the summer semester for just to get to know one another, experience the work that's being done, and grow in their language skills.
Thank you. I'm going to give just one final moment before we end. If there's anything that any of our panelists may want to share that we that maybe you haven't said or the question wasn't asked about this university community partnership. If there's anything else you'd like to add that maybe we didn't cover? Any final comments?
I just would like to say yet again that I appreciate so much the silver lining of what the pandemic has given us in terms of pushing forward these relationships with the community. And I hope that we don't lose the traction on that and we continue these really valuable partnerships.
Thank you. Just a word of gratitude for the wonderful work that's been highlighted here from panelists and different organizations and initiatives and sources. I also have a very specific request as a clergy person, especially in this area of the United States, the famous Bible Belt. You find a church in every corner, you know. Our North Carolina Conference of the UMC, which comprises the region from Burlington all the way to the coast, has 800 plus local churches. And so there's an opportunity for connection, leverage of resources, mutual support and collaboration. So I'd just like to invite all who are here to consider exploring partnerships with the local church.
And Reverend, the Nicholas School and the Divinity School actually have been working together, and we have a whole Blue Theology working with pastors on climate anxiety that's happening next month that kind of came out of some of this resilience work. But I think it drives home that churches are the bedrock for many of our communities. And as academics, we can lose focus of that. And so remembering where our churches are and how important they are, and how important the service aspect of churches are within our communities, I think is really worth listening to.
Great. Well, thank you all. Any other comment? Did I miss one? Great. Thank you all for your information, for sharing information about your partnerships. It's such a wealth of information, and we really appreciate, again, the dedication of our community folk working with the university academic people as well. So we want to remind everyone of the afternoon session that starts at about 12:30. We encourage you during this break, we're going to be showing videos of examples of some of these partnerships that we've talked about, additional partnerships. It's there on your screen now. So we would love for you, if you're going to grab your lunch, to come back, and these presentations will be going, running just automatically. So we'd love for you to hang around and watch the presentations.
On behalf of the conference organizers, I just want to thank you all for being here. Estamos muy agradecidos por la presencia de todos and for joining us. And we'll see you again at 12:30, but please do have a wonderful lunch and watch some of these videos. They are entirely impactful. They are wonderful examples of exactly what we've been talking about. And I hope that you'll be able to enjoy them while you enjoy your delicious food. But we'll see you again at 12:30.
Que se atrasaron con esto de la pandemia. Hay demasiados niños que van atrasados. Uno de ellos pues son mis dos niños. Es algo muy bonito para ellos también, que ellos se sientan libres de expresar lo que saben y no saben de la escuela. Pero ellos felices. Gracias a Dios que encontré ayuda para ellos.
This is Iglesia Manuel. It's home to one of the largest food distribution centers in Durham, serving around 600 families. Now here is Margaret and Miguel. They help expand the food distribution program and spearheaded Iglesia Manuel tutoring program. As of this year, 2022, around 23 students from many various Durham public schools, from elementary to high school, are getting tutoring in math, science, reading, and writing. And you can be part of the tutoring team too. COVID-19 exacerbated the achievement gap of students from low socioeconomic backgrounds, and this adds on the struggles of students whose parents have immigrant status in the U.S. Many of these kids are dealing with devastating loss that online learning has caused. The multifaceted changes COVID-19 brought was the reason Margaret and Miguel brought this tutoring program to life. Our mission is to reconnect students to their love for learning and rekindle a drive to be the curious, driven leaders for tomorrow. We are looking for committed, passionate people who will help bridge the achievement gap, people who will coach kids through their academic and personal goals and dust off their skills, people who will motivate them to see beyond external limitations and tap into their inner potential. We need leaders who are willing to take risks and to take a stand in the community for those that need it the most. We could especially use some tutors who are confident in middle school math. Many of our students' families speak Spanish. You don't have to speak Spanish, but of course, that's a bonus. Over all else, the most important thing is that you are committed to this program. These students need us every week, so make sure you're dedicated for at least a whole semester or more if you want to tutor for this program. The church is located just a few minutes away from Duke's and NCCU's campus. So if you want to get involved with this tutoring program, we would love to have you.
Keep waving. Keep waving. Keep waving.
What is it that makes North Carolina our place? What makes it home? For some of us, it comes from deep down. Our people are here. For some of us, even while it's home, it's a place we experience systemic inequality. For still others, it's a new place full of excitement. For some, North Carolina provides environmental initiatives to support and research to explore. For many like myself, it is the place we created our first memories and the place we will cherish our last. North Carolina is my place. After college, I lived in 7 other states and worked as a documentary photographer in more than 20 countries. Throughout that time, when someone has asked where I'm from, I haven't hesitated. No matter where I was living at the time, I'm from North Carolina. My name is Susie Post Rust, and this is my photographic exploration of my home. My mother, Rose Post, moved to Salisbury, North Carolina when she was 13. My grandparents were opening a clothing store on Main Street. It was the Great Depression, and they would live above the store. Like in many small towns in North Carolina, Main Street is also Highway 70. My grandparents' store, Zimmerman's, was on the right, just beyond Council Street. My mother lived in North Carolina all but 2 years of her life. This is a legacy she has given both me and my daughter. Rose Post worked as a writer at the Salisbury Post for more than 50 years. In 1998, she traveled the main streets of our state, looking for what it means to be a North Carolinian. She began her project in Atlantic, North Carolina, where the ocean meets the land and the trees bend away from the salt and the sand. She journeyed on Highway 70 across North Carolina, all the way to the Blue Ridge Mountains on the border of Tennessee. And now I'm doing the same, traveling Highway 70 across North Carolina. I'm primarily photographing, not writing. I'm inspired by her words and informed by her journey, but I'm not revisiting every place my mother went, although in some situations I am finding the next generation. This year I was fortunate enough to become part of the Community-Engaged Scholarship Collaborative at Duke. I've been working with this generous and supportive cohort to expand the project. I began photographing in the fall of 2019, and I wasn't really sure what direction it would take. In March of 2020, COVID arrived. Things shut down indefinitely. It felt like a cloud descended, and it seemed that overnight we became isolated. A darkness enveloped many people. Daily COVID updates were sent, and fear escalated. Meanwhile, members of Reopen North Carolina marched weekly in our capital. Protesters made demands of the governor outside his mansion. An anonymous Grim Reaper wandered through the crowd of unmasked protesters, silently challenging their view. Food insecurity surged as children who were receiving 2 meals a day at school were no longer at school. Local volunteers worked with restaurants and the DPS Foundation to create a delivery system for anyone who needed food. And then George Floyd was killed. Thousands of mourners flocked to Rayford, North Carolina to attend his memorial. Friends clung to each other after seeing the casket, wondering aloud what kind of world their children would face. Students in Durham organized a candlelight vigil, drawing more than 500 people. They sat silently for 9 minutes, 25 seconds, the amount of time that Floyd was pinned to the ground. High school students still celebrated and still mourned the transition. Protests against police brutality marched straight down Durham's Main Street. It was a time of reckoning. The summer was charged with passion. What crystallized for me is that while fighting for what we believed in, we became adamant against others. With our individualized news feeds and the election looming, the people with whom we disagreed became whole groups that had labels: immigrants, the religious right, liberal white women. I made a decision about this project. I decided to dig deeper and document individuals who fit into those categories, but without naming the label. I wanted to find what we have in common. As I've traveled the road, people have welcomed me in. I've seen a glimpse of our shared humanity. We are a diverse place. We have different religions. We have different skin color, different sexual orientations, and different political views. We accept chaos, but we look for elegance. We are creative and we are unique. We value family and we need solitude. Through all of this, change is the constant. The distinct contrast that I found made me wonder if we are not better off for living with our diversity. My mother wrote, "People are like the road, changing, getting lost, disappearing, and then finding their way again, always changing." As I've worked on this project, I could feel my mother's touch, helping me understand our divided world that she no longer shares with me. So I will end with words from her story. Like a train whistle in the night, a road always calls us on, a ribbon into tomorrow. It tempts us with tales we haven't heard and sights we haven't seen and food we haven't tasted, and makes us wonder if we're like those people further on, or are we different?
Community Health Coalition. Since 1989, North Carolina's Community Health Coalition has connected passionate leaders and doers in the field of medicine, education, mental health, faith organizations, law, finance, the military, and social advocacy to achieve one united goal: health equity for everyone beyond today's racial and socioeconomic barriers. Serving Durham County and the surrounding areas, CHC strives to create a society in which all people live healthy, active, and purpose-driven lives. Meet our Executive Director. Dr. Phillips, affectionately called Dr. Ruth, relocated to Greensboro, North Carolina in 2008 from Baltimore, Maryland. Ruth received her bachelor's and master's degree at Morgan State University and her doctorate in podiatry at the Temple School of Podiatric Medicine. As Executive Director of Student Health and Counseling Service at North Carolina Central University, Dr. Phillips developed programs partnered with national organizations, collaborated with fellow campus departments and student groups to generate change not only for students, but faculty and staff as well. In 2020, Dr. Ruth was named Executive Director of Community Health Coalition to continue founder Dr. Elaine Hartbrother's legacy of compassionate and visionary leadership. In addition to her role at the Community Health Coalition, Dr. Ruth serves on the National Our Health Matters Task Force for Jack and Jill of America, Incorporated, the Just Us Warren Heart Disease and Stroke Prevention Governor's Task Force, the American Heart Association Triangle Board, the American Cancer Society Central and Eastern North Carolina Board, the Diabetes Research Foundation Board, and the American Cancer Society Advisory Board. Services and programs. Together with our community and healthcare partners, we offer many programs that encourage people to be proactive in improving their lives, regardless of socioeconomic barriers. For the next few slides, I'll be briefly discussing our services and programs. Maternal and Child Health Symposiums. From November 2020 through June 30th, 2021, the Community Health Coalition had 7 monthly symposiums. Over 170 women took part in our symposiums. Utility Assistance Program. With our engagement and outreach efforts in Durham, Granville, Person, and Orange counties, we were able to assist 159 families with utility bills totaling over $62,000. COVID-19 vaccine, literacy, and testing campaigns. Our outreach efforts led to more than 6,000 children and adults being vaccinated, tested, and/or receiving PPE. Integrated Care Program. With the introduction of our Integrated Care Program, as part of addressing the needs of the whole person, we connected over 885 individuals with peer support for physical and/or mental health needs, as well as assisted with social economic barriers one may encounter. Food insecurity. Community Health Coalition was able to provide 4,572 meals and/or groceries to individuals in need living in marginalized and/or underrepresented communities. Digital connection. 4,325 members are currently on our listserv. Please save the date and plan to join us at Duke Golf Club on Monday, May 23rd at 9 a.m. For more information, please click the following link below. Our ask of you: if you are not connected to Community Health Coalition, get connected. Please follow us on Twitter, Instagram, and like our Facebook, and sign up on our website to receive our newsletter. Thank you.
Welcome to our virtual presentation about our Duke and North Carolina Central University Assisted Community School Research Project. My name is Alec Greenwald, and I am the Associate Director for Strategic and Special Initiatives to the Dean of Academic Affairs in the Trinity College of Arts and Sciences, and a proud member of this research team.
Hi, my name is Yolanda Dunston, and I'm a professor in the School of Education at North Carolina Central University, and also a member of this research team.
And my name is Xavier Cason. I am the Director of Community Schools for the Durham Public Schools Foundation, and also a community member of this research team. Our research team is a collective of students, staff, and faculty from Duke and North Carolina Central University. For the past 3 years, we have been working closely with public schools and university leaders across the country to advance the movement for full-service community schools. We have been exploring how universities can build capacity for public schools in imaginative and responsible ways. By learning how to ask the right questions and listening deeply to public school and community stakeholders, our research collective has developed 3 large and often intersecting questions related to developing an anti-racist curriculum, creating a visual dashboard, and addressing health needs in Durham.
The curriculum team addressed the research question of how do we best prepare undergraduate students to enter Durham Public School classrooms with a critical lens for race, class, and Durham's history. Through previous years' qualitative research, our team was in conversation with peers at Duke and NCCU and with DPS educators. Their findings determined that there was a need for an anti-racist curriculum that would prepare these undergraduate students to respectfully interact with DPS students from different demographic and socioeconomic backgrounds. After identifying the strengths, weaknesses, opportunities, and threats, and creating a curriculum like this, our team was able to develop a 12-week anti-racist curriculum with learning objectives, course materials, and assessments on Google Classroom. In the future, this curriculum will help support Duke and NCCU students in their work with DPS students and enhance their cultural competence, as various community-engaged faculty on both campuses have expressed interest in piloting the curriculum in their service learning and education courses over the next academic year.
The data sub-team addressed the question, how do we build a robust online dashboard that prepares undergraduate students, DPS teachers, and DPS parents to understand their neighborhoods through an asset-based perspective? In efforts to increase community members' accessibility and awareness of Durham assets, understand the narratives of schools, and improve partnerships, our sub-team spent the semester assessing the need of this tool. With the support of a Data Plus team from last summer, a pilot dashboard has been created that identifies key data points for 10 schools in closest relationship with Duke and NCCU. This year, we researched other dashboards and looked at other community school models to logically think of what other variables we might want to include. We hosted a focus group with principals, asking them a series of questions in order to learn where the gaps existed in our current model. Upon completing our interviews with principals, we learned that language accessibility is vital. We plan on continuing to elicit feedback from DPS students, parents, and families to further enhance our dashboard. Our team is continuing to mine for additional data points to display in a way that continues to be accessible for school leadership, families, and community members.
The goal of the health sub-team was to evaluate how community schools and local universities may provide broad health services based on community needs. First, we conducted a literature review of significant health needs in Durham and focused on affordable housing, food insecurity, and mental health. Next, we identified high-risk schools that had over 80% students on free and reduced lunch and were over 1 mile from a health center. We wanted to conduct a parent-led focus group, but because of low response rates and limited research in Durham Public Schools due to the COVID-19 pandemic, we shifted our approach. We recruited Mrs. Tamra Vanier at Glen Elementary School to lead a parent-led focus group and discussion. Glen Elementary School has the second highest free and reduced lunch percentage and is the furthest away from a health center out of the 10 initially identified schools. While undergraduate research is being limited by DPS to ensure that staff and students are able to focus on learning and teaching, we learned how to turn rejection into redirection.
Each year, our team takes site visits to learn from leaders around the country. This allows us to engage with our community school partners and reflect on how these models may translate to Durham. Our research has significant local and national implications. Full-service community schools are evidence-based models that address racism and poverty that often land on the doorsteps of public schools. Together, through our research experience, Duke and North Carolina Central University have the capacity to build strategies and political will for the expansion and sustainability of community schools here in Durham.
We have a strong team of people from such diverse backgrounds who come together to do meaningful work to prioritize community building. We are excited to see where the future years of our Basque Connections team takes us. Thank you very much.
Hello, and thanks for watching our video. My name is Nicole Schramm-Cepeda, and I'm from the Duke Institute for Brain Sciences. I'm going to tell you about our group's work with mental health and the justice system in Durham County. This work would not be possible without the efforts of my amazing co-leader, Maria Tackett from the Department of Statistical Sciences, and my collaborator, Michelle Easter in the Department of Psychiatry. And also the rest of the team. We've been supported by the Duke Bass Connections and Data Plus programs, which support undergraduate involvement. We've also had 2 graduate student project managers over the years and an army of really wonderful undergraduates who have helped with all this analysis. We've also been supported by funding from the Duke Office of Durham and Community Affairs. So this work has been done in partnership with all of these agencies around Durham, all of whom have a long-standing, really serious, dedicated commitment to improving the lives of the people with mental health issues, mental illness, who are involved in the criminal justice system. This is a long history going back to about 2006 of doing really concrete positive steps to support that population. When we came in, what we did was to take data and help them with data analysis. So we merged data from the Durham County Detention Facility with data from Duke Health. So we know the population that is going in and out of the detention facility and coming to appointments at Duke Health. None of this would be possible without the services of Duke Health's Analytics Center of Excellence, whose mission is to take health data and make it accessible for analyses like this. So our big goals were to inform our county stakeholders about the extent and severity of mental health issues that are present in the justice-involved population in Durham. Second, we wanted to assess the relationship between Duke Health use and interaction with the criminal justice system on the part of those involved. And ultimately, we want to build networks of collaboration to continue to improve outcomes for these most vulnerable members of our community. So the first thing we can say is that, not surprisingly, mental illness is highly prevalent in the Durham County Detention Facility. About 16% of people in the facility have what is known as a serious mental illness, and this is defined as either schizophrenia, bipolar disorder, or major depressive disorder. Another 25% in the detention facility have some other mental health diagnosis, and this group includes drug addiction, post-traumatic stress disorder, anxiety, depression, developmental delays, sort of a catch-all of all the other mental health diagnoses. 27% of our population in the detention facility had no mental health diagnosis from Duke Health, but another 32% were unknown or unmatched to Duke. So we can assume that the prevalence of mental illness in the facility is a little higher than what we've stated here. Even with Durham's long history of programs and services, what we find in our data is that we still have the most serious patients having the most difficulty. Those with co-occurring serious mental illness and substance use disorder remain the most likely to be rearrested. Those who are frequent users of the Duke ED are also more likely to be frequently rearrested. So we have a population of people that are cycling repeatedly through both systems. One of the things that was most surprising to us is that a visit to the Duke ED is associated with an increased likelihood of rearrest very soon, in fact, in the next month. So it looks like a visit to the Duke ED is a warning sign that things are not going well for that person. And very often the crime types that we're seeing people get arrested for are often low level, not always, but I think we have a real opportunity to help people that are committing low level crimes and also cycling between both systems. So with that, our team's next steps are, first of all, we're going to be mapping using GIS to map neighborhoods of the arrestees versus health services to see, would it be possible for them to get services before they get into a crisis situation? We're going to continue to analyze the effects of specific policies in Durham and North Carolina. As we said, the policies have evolved and many improvements have been made over the past few years, and we want to know which ones are working and which ones might need to be set aside. And ultimately, as I said, we want to build collaborations and continue to think about things in a combination of the medical and legal system level. I would love if someone wanted to reach out and brainstorm collaborations in implementation science or systems analysis to think about how do we make medical and legal systems that cooperate together and have as both of their goals the best outcome for the people involved. So once again, I want to thank our supporters. We had a small grant from the Duke Office of Durham and Community Affairs. And as I said, our undergraduate and graduate students were funded by Data Plus and the Bass Connections and Brain and Society program. So thank you so much for your attention. And I'm happy to receive an email, think about collaboration, hear any questions that you might have. Thanks for your time, and I hope to see you soon.
Hello, I'm Justin Ridge, and I'd like to talk to you about some of our endeavors to engage our local communities in the science we've been doing here at the Marine Lab. This work builds upon some of the Marine Robotics and Remote Sensing Lab's efforts to develop programming to enhance K-12 student science literacy and inspire the pursuit of STEM careers using this novel technology of drones. Partnering with local boys and girls clubs, we are developing a multi-stage program where we begin training local teens how to pilot drones and then use them for immersive science activities.
No.
There you go. Testing, testing. Okay.
In the first stage of the program, we've been coming up with creative ways to get the pilots familiar with the drones and how to operate them.
Fly. Oh, I got flying him. Pretty cool. But yeah, like we did like a little one time with like the other one. We did like a little scavenger hunt, and it was like five, six, I don't remember how many different animals. And it was like clues, and like they're on the wall, and like you would just have to fly them, get to them, take a picture with the camera.
Nice, yeah.
My favorite was breaking down the towers.
Yeah, when we were knocking down. The first time y'all came, you know, knocking down the blocks. None of it.
None of it? Even the sticker part, nope.
Hold on. The sticker part? Really? You like the stickers?
Stickers
I'm
are
having
good.
I'm having to think.
The thing that I think is boring about the drones, the only part is when we have to figure out which drone is which and connect them up. Because literally last week, mine and Zoe's tablet was connected up to a different drone than Whale Shark that we were trying to get onto.
Now let me tell you about one of the next phases of the project. Better yet, let me show you.
Welcome to Antarctica, Junior Explorers. Get ready for takeoff.
What you are looking at here is a virtual reality experience we have created using 360 video from our Antarctic research. The students will have a choose-your-own-adventure style activity where they will learn about different aspects of the Antarctic ecosystem through an interactive process. We have just completed our first draft of the exercises and will be testing it out with our junior pilots this summer.
Ice is an important part of daily life in Antarctica. Here, sea ice forms and melts every year. In the winter, this bay is completely covered in a continuous sheet of ice, much thicker than the ice floating below you. Many animals in Antarctica depend. krill feed on tiny plants called algae that grow beneath the ice. Many of the animals in Antarctica rely on krill for most of their food. If you have a partner, make sure to switch turns at the end of the first path so you both get a chance to fly the drone. Let's go. In this quiet, still bay, we're waiting for a whale to come to the surface to take a breath. Look to the left to find our researchers. They're waiting patiently for a minke whale, one of the species commonly found in this area. Here it comes.
Greetings, everyone. My name is Jasmine Benner. I'm the project lead of reducing vaccine hesitancy at HBCU. My faculty mentors were Dr. Jonathan Livingston and Dr. Saranda Robinson. The Department of Psychology and Public Health Education were involved in this partnership. The goals of reducing vaccine hesitancy at an HBCU was to reduce vaccine hesitancy, increase knowledge of the COVID-19 vaccines, increase COVID-19 testing, and vaccination rates. According to the North Carolina Department of Human Services, only 53% of the population are vaccinated. Some of the ways we worked to reduce vaccine hesitancy was hosting a social media campaign asking our peers why they got vaccinated. We also showed an ethnodrama called the Right Now Show. After obtaining IRB approval, participants were given a pre-survey and then were given a post-survey after viewing the film. Pre-survey data suggests some participants did not feel comfortable taking the vaccines, needed more information, and they did not trust the government. On this slide is the pre-survey data. One of the questions asked was, I don't trust the government, knowing that I have to give my personal information in order to get a vaccine. As you can see, a lot of participants said they agree somewhat or they would prefer not to answer the question. Another question that was asked is, I need to understand how the vaccine works before I will take it. A lot of the participants said they agree somewhat or they strongly agree. On this slide is the post-survey data. One of the questions was, I get any vaccine, one shot or two, that is effective enough to prevent serious illness or death from COVID-19. As you can see, a majority of the participants strongly agreed with that statement. Another question was, taking the COVID vaccine may reduce the likelihood of severe complication from COVID-19 and new variants such as Delta and Lambda. The participants strongly agreed with that also. Some of the limitations we have encountered is participation in the social media campaign and the Right Now show. Since it was shown via WebEx, we couldn't tell how fully engaged participants were. The greatest impact this project had was influencing perceptions and attitudes regarding vaccine hesitancy. Survey responses after showing the Right Now show suggested more positive attitudes towards vaccines. In the fall, we will continue the work of reducing vaccine hesitancy with more social media campaigns and sponsoring the vaccine clinic.
Welcome back to the Community-Engaged Scholarship Symposium. My name is Leslie Parkins, and I'm the Assistant Vice President and Director for Civic Engagement with the Duke Office of Durham and Community Affairs. I served on the planning team for this event, and I'm so grateful to have this time together to learn and to share with one another. If you joined us this morning, you had the opportunity to hear kickoff remarks from Debra Clark-Jones and a keynote from Dr. Wanda Boone. both offering insights in the challenges and opportunities and community collaborations to frame our day. And the morning panel highlighted partnerships addressing emergent issues, featuring representatives from AACT Plus, the Coastal Climate Resiliency, and Latin 19. These panelists offered insight and expertise on successful approaches, lessons learned, and impacts of their collaborations. And over lunch, we offered videos of various community-engaged scholarship projects. These videos highlighted award recipients from the Community-Engaged Research Initiative and Duke's Clinical and Translational Science Institute, and also projects from the Community-Engaged Scholarship Collaborative. I hope you all had a chance to enjoy those over lunch, but if not, they are available online and we can share that link with you. And heading into the afternoon, I'm reminded of how much wisdom is shared here. And I want to take this opportunity to reflect back some of the insights that I'm holding on to from the morning. Starting us off, Debra Clark-Jones grounded us in the need to gather and to collaborate for the kind of change we seek to create. And in thinking about that change, Dr. Boone spoke to the need to respond to communities with approaches fitting their experiences and priorities. Dr. Burch echoed this sentiment in sharing that communities must determine what is relevant to them, not powerful institutions or the powers that be, and that each community has unique experiences, wisdom, and challenges that will better inform the issues and approaches. And we continue to discuss communities and their role in partnerships. Pastor Vergara reminded us, we are not the voices for the community. They have their own voices, and our role is to amplify them. And Dr. Feldsman spoke to the value and lessons from community members who use their voice to demand greater respect and participation in partnerships. And as we seek to find partners in community, Dr. DeMattia encouraged us to look for ways to work alongside community members in the shared spaces where they are already showing up. We heard from Dr. Wilder about the need for partnerships and impact to be sustained, even as they work to address urgent priorities. And as we think about sustaining our efforts, Karen Amspacher offered up the need to ensure partners are showing up through all the days and the hard nights, and not just when the weather is good. This afternoon, you'll have the opportunity to continue to hear about additional partnerships from our speakers and panelists. Our afternoon keynote speaker is Dr. Viviana Martinez-Bianchi, and our panelists highlight their approaches to collaborate for impact and feature communities in partnership, families and communities rising, and university-assisted community schools. Let's make sure we continue to let this wisdom soak deep into our roots so that we might go forth in our partnerships and collaborations in even more meaningful ways. I'll now pass the floor to Dr. Liz Shapiro-Garza, who will introduce our afternoon keynote speaker.
Hi, thanks so much, Leslie. That was just beautifully put and beautifully summarized in terms of some of the main takeaways from the morning. I am just really looking forward, I will say, to hearing the wisdom shared in the afternoon as well. As Leslie said, my name is Dr. Liz Shapiro-Garza. I'm here today in my capacity as the Faculty Director for Engaged Scholarship through the Duke Civic Engagement Office. It is my absolute pleasure to introduce our second keynote presenter of the day. Before I do, I will just encourage you, if you have questions for Dr. Martinez-Bianchi, please feel free to put them in the Q&A chat, and she will be able to respond later. Dr. Viviana Martinez-Bianchi is an associate professor and director of health equity at Duke University's Department of Family Medicine and Community Health, as well as the department's director of health equity. As a family physician committed to health equity in her community and around the world, she was recognized as North Carolina's 2021 Family Physician of the Year by the North Carolina Academy of Family Physicians. Dr. Martinez-Bianchi is the co-founder of the Latinx advocacy team and interdisciplinary network for COVID-19. And we heard so much about that incredibly impactful partnership in the morning, Latin 19. Latin 19 was established in March of 2020 to address inequities in the COVID-19 pandemic response, the health system, and communities in Central North Carolina. At the state level, Governor Cooper appointed Dr. Martinez-Bianchi to the Andrea Harris Social, Economic, Environmental, and Health Equity Task Force. At the national level, she chaired the Health Equity Team for Family Medicine for America's Health. And at the international level, she has been on the executive committee of WONCA, the World Organization of Family Doctors, and the liaison for WONCA to the World Health Organization from 2016 to 2021. It is my great honor and my great privilege and our to our great benefit to have Dr. Viviana Martinez-Bianchi providing our second keynote of the day.
Thank you for that introduction, Dr. Shapiro-Garza. I am thankful to the Office of Civic Engagement in the Office of Durham and Community Affairs and to CTSI, and especially to Leslie Parkins for the invitation to give this keynote speech today, and especially for their support of the work we're doing with Latin 19. Indigenous and immigrant, together we stand tall. Our histories are relevant. An injury to one is an injury to all. These words are an important driver to my passion for working with you, with others, together, improving health for all, and especially for Hispanic families. This is my conflict of interest disclosure as a Latina immigrant who discovered 30 years ago, upon arriving to this country to train in family medicine, how much there was to do if we wanted to provide excellent care to Hispanic families and to everyone. I am passionate about paying attention and not being silent when seeing injustices, upstanders recognizing when something is wrong and doing something to make it right. But who am I? I'm a Latina, an international graduate, an immigrant. I embarked in this academic journey when I was still a teenager growing up in Argentina, and dreaming that one day we will together make a difference. Only one who stops dreaming is defeated. Solo está derrotado aquel que deja de soñar. Recognizing that health is a political choice should activate all of us to work on advocacy and engagement of every member of the community, and especially of decision makers. I stood in front of this poster at the United Nations 12 years ago, reading this quote from the Declaration of Human Rights and thinking how far we are from this to be our current reality. How many people around the world are not truly free, how many are victimized and not considered equal in dignity and rights, especially within our own US borders, where it doesn't take a lot of observing or critically assessing how Latinx and other immigrants are being placed in infrahuman conditions. A country where Black lives often do not appear to matter, and where we see multiple attempts to limit who votes. In a democracy, limiting people's voting. In equitable cultures, all persons can have similar choices. But what can we do when we live in a world where the circumstances are stacked up so differently for different members of our communities? Respecting, learning about, and understanding people's identities is providing dignity to the individual and communities we serve. And now about health equity. What is health equity? I like Dr. Camara Jones' definition because she invited us to action. Health equity is a process of assurance of the conditions for optimal health for all people. She is proposing that each of us works in these three areas. Number one, valuing all individuals and populations equally. Number two, recognizing and rectifying historical injustices. Number three, providing resources according to need. As researchers and educators and health clinicians, we want to train ourselves and our learners as comprehensivists, upstreamists, seeing the idea of a river that Dr. Rishi Manchanda talks about, training as health professionals who, when we see the river of disease that flows into our clinics and hospitals, we will go to identify what happens upstream, systematically understanding and addressing the social determinants of health and bringing that understanding into the workforce and the workflow of clinical care. Opening doors we have not opened before. At the core of the inequities is the concept of intersectionality, the interconnected nature of social categorizations such as race, class, and gender, regarding as creating overlapping and interdependent systems of discrimination or disadvantage. and the need to identify the advantages and disadvantages that are felt by people due to a combination of factors, including racism, ethnophobia, homophobia, misogyny, and sentiments against people with different abilities or size. Using a trauma-informed lens in education, healthcare, and research, understanding what happens in people's minds. As educators, we want to train people who can listen to an immigrant story and understand that there might be acculturation stress, that the story might be more complex than initially understood in regular clinical backgrounds. And recognize that racism is a pandemic we all need to strive to eradicate as hard as we are working to eliminate SARS-CoV-2. Learning how to do effective advocacy is key to our work as researchers, educators, and clinicians and community. I have enjoyed learning how to influence equity decisions within political, economic, health, and social systems and institutions, and acknowledging and recognizing how I can use my privilege. And you, what catapulted you to advocate? Was it striving for racial equity, advocating for your work, for primary health care for all, for preventing the oceans to continue to rise, for reproductive rights, witnessing racial inequities? 30 years ago, I moved from Argentina to this country. And as I was applying for residency program positions in a suburb of Chicago, I was seated at a recruiting dinner with a program director, a faculty, and a resident. We were at a restaurant and I could hear the conversation from the kitchen, multiple words in Spanish amidst the sounds of a busy kitchen, from "Pásame las papas fritas," pass me the French fries, to big swear words, making me chuckle at some of the comments. As we are finishing dinner, the director states that they would really like for me to join the program, that they thought I would fit in well, and that they loved that I spoke Spanish, except, he added, the only issue is that you wouldn't be able to use your Spanish here. I looked surprised because, he added, there are no Hispanics here. I started realizing then that many Hispanics, many members of the Comunidad Latina in this country, and many other communities live in the interstitium of our society, invisible to the eyes and unheard of by those ears who do not see, those eyes who do not see them, or those ears who can't understand their spoken language. Yet, just like the interstitium is to our bodies and our lives, vital to our US economy. This and other experiences initiated me in this path to elevate people's voices. Just like Edgar Vergara said earlier today, every person, every community has a voice and a story to tell. The issue is who is listening, or who is able to listen, or who is able to understand the language of the voices of the community, who is taking the time, listening with our hearts and seeking to engage. Take the time, listen to your heart, seek to engage. Now let's talk about strategies. Many of us have been involved in strategies for change in our health system, schools, programs, and communities. There are multiple frameworks like this one from the National Institute for Healthcare Management that I often use. It is embedded in my mind and soul to make sure that we work on improving access to culturally competent care, that we recruit people from the communities we served, that we provide anti-racism training, that we improve bi-directional health literacy. The understanding here that we often talk about patients' health literacy or poor health literacy without ever taking a moment to see if we as doctors or members of the health care team or educators are literate about our patients' perception of health and illness. supporting community health workers and federally qualified health centers, and working with the community to build trust is one of the most empowering things that we can do. Health equity work requires an acknowledgement of power and privilege, including within the organizations leading this work. Creating safe and respectful environments for all members to contribute their feelings, stories, and perspectives in their own style and approach, and upholding confidentiality. We need to leverage and build on the contribution of each member to create better outcomes, settling into becoming comfortable with the uncomfortable, bravely leaning into the discomfort through provocative inquiry, patience, and discussions. Addressing our differences intentionally, working to understand intentions and their impact, and modeling behaviors that respond effectively to microaggressions and ouch triggers. Respecting the time and honoring our commitments, coming prepared to our meetings, being transparent in our intentions, and making sure we value the community's contribution. Improving population health in a sustainable way requires working through partnerships among multiple community and society stakeholders. Creating multi-sector partnership for health equity is one of the most empowering processes that we can initiate. The need for a collective response led to the creation of Latin 19, a coalition of passionate advocates for our community. You heard about it earlier today. We've been meeting every Wednesday at noon to discuss gaps, needs, strengths, inform, educate, and learn. We were 30 people when we first got started, never expecting we will continue 2 years later, 97 meetings and counting, 50 to 100 people attending every Wednesday. It is through listening in these meetings that we increase awareness about the Comunidad Latina in Durham and beyond. A multi-sector group representing multiple disciplines, a network consisting of more than 1,000 registered participants. You heard about one of our collaborations earlier today. For more detailed work, for making sure that we are providing an inclusive environment that is multidimensional, I like to use a health equity and empowerment lens, adapted from racial justice activist Sonali Balaji in Multnomah County in Oregon. The lens uses 5 Ps to be paid attention to for issues and decisions, focusing on impact in the areas of people, place, power, and process, and purpose, highlighting the importance that in a purpose-driven system, all partners at all levels align around transformative values with relationships and goals moving towards health equity, integrating an emphasis on preventing harm and supporting actions that heal and transform. What is our institutional purpose towards health equity? How are we clearly defining that purpose, and where and how do we communicate it? How can we ensure that our purpose is integrated into policies, procedures, and practice, giving team members a greater sense of meaning around what they do in health equity, recognizing that inequities are harmful, aligning the right people and plans to achieve the purpose of preventing harm, and ensuring individuals work together with leaders to align purposes towards health equity. And then people, under the first P. We ask who is positively and negatively affected by this issue, and how. Who are the people in my community most likely to be vulnerable to the issue? What are the physical, spiritual, and emotional contextual effects related to the issue? How do people perceive barriers? Let's have a reminder of factors leading to increased vulnerability. I like this graph from the World Health Organization that looks at those factors, and especially what you need to look in for times of emergency management and crisis response. As a group, as a population, unfortunately, we can check off multiple factors leading to increased vulnerability for the Comunidad Latina. This was happening before the pandemic hit. High percentage of uninsurance would result in poor access to healthcare services, marginalization due to language barriers, fear of deportation, working and living in overcrowded conditions. And lastly, Latinx often encounter health systems that were not culturally congruent and government with policies largely affecting their vulnerability. ICE raids, ethnophobic policies, anti-immigrant sentiments, the otherness of a population not recognized as essential to the economy of the state or the country. Among the many factors that place the Latino community at risk, just as for other historically marginalized populations, many were tied to their economic contributions to the state and the country. When we talk about place, we ask what kind of positive or negative place are we creating? How are resources and investments distributed? How are you considering environmental impacts and environmental justice? Experiences of discrimination in the health system led to warranted mistrust. In May and June of 2020, I started receiving texts from community members and activists and asked them to join us at Latin 19 calls to share their stories. Fear of deportation, people disappearing into the health system. During another Zoom meeting, church leaders shared that they were hearing from members of the community who wanted to learn how to prepare to die at home, so they would not die alone at the hospital or burden their families with hospital bills. We later learned that Hispanics in North Carolina died at home twice as often as non-Hispanic people. The comments heard during the Latin 19 meetings from community members prompted the creation of subcommittees that went on to identify problems and take actions to improve the patients and community experience. It is building this with the community that we can work on resisting and training to identify how to resist the dehumanization in the midst of so much illness and stress, and making sure that requesting the presence of an interpreter is part of the flow of the care of those with limited English proficiency. So thankful to have interpreting services during this meeting. Many of the stories heard helped design the strategy and topics for public service announcements, radio, and material we developed with multiple partners. Now let's go to process. How are we meaningfully including or excluding people who are affected? What clinic policies, processes, and social relationships contribute to the exclusion of communities most affected by inequalities? What empowering processes can we initiate? We have been following the syndemic approach initiated by Dr. Rosa Gonzalez-Garda at the School of Nursing with the Ser Hispano project, understanding how these multiple epidemics, acculturative stress, and resilience factor interdigitate and work within the Comunidad Latina. You heard earlier about the initial distribution of testing sites. Now vaccine distribution initially followed similar patterns. If we want vaccination equity, we need to highlight the importance of doing vaccines where community already trusts, like churches and neighborhoods with trusted partners in the community. You heard about the work that we've been doing with La Semilla, where we have multiple partners in the community, like El Centro Hispano, with whom we've been working as well. Co-locating vaccines and testing in neighborhoods and parking lots of businesses frequented by the community and provided guidance to people testing positive. We work to increase access and community trust, hitting the airwaves, informing community together with community members. Working now with the Youth Ambassadors Program. One of our efforts for the inclusion of the Comunidad Latina in research has been the creation of community consultation studios in collaboration with CTSA, where researchers can have a listening session with community participants who serve as experts and provide feedback. Another effort which Dr. Leonor Corsino led together with the health system was to obtain support and funding to have DeMattia in Spanish, supported by interpreting services. We are partnering with Isla on a newer project, the Latino Youth Health Ambassadors, to empower Latino youth to have conversations about the vaccines. We recognize the immense need for mental health access in the community and partnered with the Office of Civic Engagement in the Office of Durham and Community Affairs to obtain grant funds from Duke's office to support El Futuro to train community health workers in Durham. We hope this will help alleviate the mental health crisis response. Working with community health workers to expand our health system's reach. Training them on COVID vaccines, the use of PPE, and how to do the testing, while they teach us how to best address social drivers of poor health. And now let's go to power. What are the barriers to doing equity and racial justice work for our system, for our organization, for our academic sector? Is there enough support? We can't continue to assign this work to volunteers. I am a faculty in a department that values the work I do, with 50% of my time dedicated to this role. What are the benefits and burdens that communities experience with this issue, and who is accountable? Are we socially accountable? Healthcare institutions are generally socially responsive. They're aware of their duty to respond to society's needs, and some can be seen as socially responsive, implementing interventions to address these needs. But few are wholly socially accountable in Berner's scale, really acting as positive change agents in the community, defining their institutional objectives together with society, creating educational programs in context with local needs, and acting as health partners in the assessment of their contributions. One of the characteristics of our collective work during this pandemic is that we became the Latin 19th tábanos. Tábanos is a Spanish name for horseflies, biting and biting, flying around until decision makers paid attention, relentless in the pursuit of health equity during the pandemic and beyond, holding ourselves and our leaders accountable, the data supporting our claims. A letter to the governor and the North Carolina Department of Health and Human Services was responded with an invitation to participate in the historically marginalized populations team for the Department of Health and Human Services, a governor's task force, and as Latino health advisor to the Secretary of Health. Our work was noted by the federal government, and in September 2021, we were invited to address the Bipartisan Committee on Education and Labor at a hearing on successful models for protecting communities from COVID-19. Eduardo Galeano said, "I don't believe in charity. I believe in solidarity. Charity is so vertical. It goes from the top to the bottom. Solidarity is horizontal. It respects the other person. I have a lot to learn from other people." We need to always be aware of these words. He dicho. Don't come to me with your extraordinary resume. If you don't act, if you don't kiss, if you don't fly, or if you don't take risks, if you don't scrape your knees, your elbows, your heart, and dust yourself off and then go at it again, don't come to me. Be part of it. I said it. Unidos somos fuerza. United, we are stronger. These last 2 pandemic years made it very clear that we cannot care for communities affected by COVID or reach vaccination equity unless we realize that our communities are first on the front line, understanding the experts and most affected by the pandemic, and that by collaborating with them is when we do the best work and reach the best outcomes. Do not stay idle at the side of the road. Muchas gracias. Thank you very much.
Thank you so much for those words of wisdom. I know they are hard won with many scraped elbows and picking all of us up and dusting off. So Dr. Viviana Martinez-Bianchi, thank you so much. I really appreciate that, and for all the work that you're doing in the world. We are honored and grateful to have you here. We are going to be moving into our panel session, and I am, this was such a wonderful setup, Dr. Martinez-Bianchi, really to be thinking about people who are in the world who are doing the hard work, that keep showing up, that keep listening, that keep trying to connect with each other to find ways to move forward in the ways that are going to be best for the communities that they serve, that they work with, that they're part of, that they're connected to. So I just want to say again, thank you for your words, Dr. Martinez-Bianchi. And we are now going to be talking about collaborating for impact. And I think that as you could see from our keynote and from our panel session and the keynote in the morning as well, it's all about connecting and collaborating and being together and finding ways to act collectively. We'll start out with presentations from each of the panel, the groups that are represented, and then we will have a more active and responsive question and answer period. So please do keep those questions coming, and we'll get to them during that time. So first, during our panel session, we will hear from the leaders of Communities in Partnership, Camryn Smith, who is the Executive Director of Communities in Partnership, and Dr. Kay Jowers, Area Director for Just Environments at the Nicholas Institute for Environmental Policy Solutions and the Keynote Institute for Ethics here at Duke University. Communities in Partnership was formed in 2011 in Old East Durham when a gathering of neighbors decided to take action following a neighborhood shooting involving 2 children. Frustrated by an inadequate and uninformed response from city officials and other local agencies, they created Communities in Partnership as a vehicle to give voice to local residents and hold local officials accountable. Since then, Communities in Partnership has been building trust and relationships among residents, developing local leaders, and changing the narrative about their community. Their work is now expanding to address the growing economic disparities among residents in light of local gentrification and the rising cost of living in our community and in Durham at large. Next, we will hear from two leaders involved in a partnership between Families and Communities Rising and Duke's Social Science Research Institute and the Clinical and Translational Science Institute. Deric Boston, if he's able to join us, is the Director of Head Start and Early Head Start at Families and Communities Rising. He's also a faculty member at the School of Social Work at North Carolina State University Mental Health, and where he's a mental health practitioner. Dr. Jessica Sperling is the Director of the Applied Research Evaluation and Engagement area in Duke University's Social Science Research Institute and serves as co-director of the Evaluation and Strategic Planning at Duke University's Clinical and Translational Science Institute. So she's a busy person. Actually, everyone I think on this panel are very busy. So we do thank them for all that they're doing and their willingness to show up to speak with us. They will be presenting on the man-to-man male engagement program at Families and Communities Rising. The male engagement program creates a pathway for families serving to engage men when a father is absent from a child's life, or to offer support for men who are seeking deeper connections with the children in their lives. And last, but certainly not least, we will hear from the leaders of the University Assisted Community Schools program, Xavier Cason, Director of Community Schools and School Transformation at the Durham Public Schools Foundation, Alec Greenwald, who's here at Duke serving as the Associate Director for Strategic and Special Initiatives to the Dean of Academic Affairs in the Trinity College of Arts and Sciences, and Dr. Yolanda Dunston, Professor and Director of the Flexible Learner Pathway for Second Degree in Elementary Education in the Department of Curriculum and Instruction at the North Carolina Central University School of Education. The University Assisted Community Schools program, and I hope you all got to see their video presentation over the lunch hour as well, but they are a collaboration between Bull City Community Schools Partnership and teams from Duke and North Carolina Central University. Their work seeks to address the interrelated challenges of disparate access to healthcare services and educational outcomes through a participant-engaged research project that evaluates the need and capacity for school-based health services in Durham Public Schools. We would like to start again with Communities in Partnership. Again, please, for those in the audience, please feel free to put your questions and comments in the chat. Dr. Jowers, Ms. Smith.
Good afternoon, everyone. I'm Camryn Smith, and I am one of the co-founders and the current Executive Director of Communities in Partnership. As Ms. Shapiro had stated we are a place-based community development organization that focuses on liberative economic development.
I think we might have lost sound.
I'm afraid we still can't hear you.
Can you hear me? Can you hear me now?
Yep.
Okay. Just wanted to let Dr. Kay Jowers introduce herself right quick.
Hi, I'm Kay Jowers. I'm with the Just Environments program at the Nicholas Institute, as Dr. Shapiro was talking about. And I've been partnering with Communities in Partnership since 2015.
And I am going to have to apologize. I'm going to have to pivot out right at 1:15 because I am actually facilitating a session with some other folks concerning our methodology and the work that we do. Who we are, we're the East Durham Collaboratories. You can see pictured myself and Aliyah Abdul-Rahman, who is one of our co-founders in Communities in Partnership, along with Dr. Kay Jowers and Dr. Danielle Spurlock, who is Dr. Kay Jowers, as you know, is situated at the Nicholas Institute for the Environment at Duke, and Dr. Spurlock is at tenure track professor at City and Regional Planning at UNC's Department of City and Regional Planning, and then also Jen Zuckerman, who is situated at the Sanford School of Public Policy within the Duke World Food Policy Council. Next slide, please. So we wanted to have a little conversation about the dynamics of East Durham. Northeast Central Durham is the community in which myself and Aliyah and all the co-founders of CIP have been living. We have each have different histories and length of times that we've been there, but we actually were founded by people who have been directly impacted on varying levels, living in the community and context in which we live and serve and work. And so as you can see some of the demographics that we have, that over 30% of our folks in our community have experienced food insecurity at any point in time of living in East Durham, and still to this day have under $30,000 or less in average median income. And 35% have high blood pressure, and over 50% may pay more than 30% or more of their income towards rent. And actually these numbers were actually taken pre-pandemic, and from our community health survey that we actually are going to re-up the data this summer to actually do our community engagement survey with Dr. Danielle Spurlock and Dr. Kay Jowers. And so we're actually expecting these numbers to actually be reflective, somewhat worsening, because what we do is we take our overall kind of measurement of people that are living in the community that are members of CIP that are living at or below the poverty scale, because also our neighborhood right now is simultaneously being gentrified as well. So we want to have a real picture of the disparity in terms of people who don't have direct access to the AMI, the current AMI for city center neighborhoods, which is somewhere between 90 and 95,000 per downtown Durham East data. Next slide, please. And so, and Dr. Kay, just after I explain this slide, if you could take it over from here, I would really be appreciative. As you can see again, our median household income, this was actually collected in response to the Mayor's Poverty Reduction Initiative. Shortly thereafter, then Dr. Danielle and Dr. Kay kind of moved into action to kind of look at somewhere in terms of the overall median household income within our neighborhood, because what we wanted to do was measure from the Mayor's Poverty Reduction Initiative, which was actually to actually ameliorate a lot of the very negative, disproportionate, negative income that was actually with quite a few of the folks that are living in our communities or the city center or city run neighborhoods that were not have access to any of these higher level wage or higher level incomes or higher credentialed jobs that were actually highly being worked at by the folks that are moving into the Durham community. And so we wanted a kind of a clear landscape of those census tracts. And as you can see, a lot of East Durham is located in 10.01 and 10.02. And so a lot of the a lot of the folks in our community have not seen an increase in their median household income, but in terms of the overall city measurement, there has been a dramatic increase simply because of those people moving in, buying the renovated houses, and actually bringing up the income within the communities, but they're doing that at the cost of displacing Black and brown, materially poor working class folk.
Right. Thank you, Camryn. Good luck with
Bye,
your
everyone.
session.
Thank you. Bye-bye.
Yeah, one of the reasons we put this information up, this is based on the American Community Surveys data, is that if we pull this from the most recent data, we'll see that incomes are starting to rise in the 4 census tracts that make up the East Durham neighborhood that CIP serves. And part of that would, to some, mean, well, people are gaining more wealth and more resources, but what we're actually seeing is displacement of community members. And so we use this slide to look at how things were in 2000, 2010, and this represents around 2015, around about the time that our collaboration started. CIP's vision is to create a vibrant place where all of the residents that they serve can have an exceptional quality of life with economic and political power to influence decision making. And as part of that, they've developed a praxis, a way of thinking about organizations to examine whether or not they are truly representing the people that they serve. So are the community organizations really rooted in the community? Are there accountability structures and board structures made up of and accountable to the community members, and do they look like the community members in terms of sociodemographics and geographical areas that they live in? So Camryn developed this definition with Naisha Frey at Duke University that community-rooted organizations are those formal and informal groups owned, run, and operated by people that live and work within their own communities. And this is just a rough timeline. You heard from the introduction that CIP started in response to a community shooting. And the answer from the police department was that the community members should go inside. But they said no and started doing trust building and community building. The collaboration that we began between Duke University, UNC, NC State, and CIP started in 2015. And we started by we all came in knowing we wanted to do something related to environmental issues, but recognizing that we didn't know where our expertise would be most valuable. So we started with community or prioritization exercises with CIP, and we had some funding that the funder understood that we were really going to be in a trust building and relationship building phase. So our obligation to generate reports and output was lessened, and the focus was really on building trust and figuring out the priority. And in those prioritization exercises, housing and food came up. And even though the team originally, we were all sort of environmentally focused, that is environment. What is more environmental than food and housing in the neighborhoods that you live in? So we have been working with CIP and providing capacity and support for the amazing work they've been doing. We started with a photo voice project, a community mapping project, and walk shops in which the community members guided researchers around the community. And over time have helped with capacity for CIP as they've started their own food cooperative, a culinary femme collective, a housing and land bank to secure affordable housing for the residents, a Black and brown farmers market, a community health worker program, and community-rooted trainings. And then you heard Camryn mentioned the community health survey that we have been doing. The pandemic interrupted our second wave, but we're hoping to get it back on track this summer. This year, we wanted to focus on tying together more closely the food and the housing work. And we are seeing in the news inflation rising and costs of buying and owning a home going up over time. We're seeing in the news around the cost of food rising. So what this community has been experiencing, these are both charts are from within the last few weeks of the news cycle. So this is very much in the news. And what we wanted to do with this small grant was really to figure out how to co-create knowledge that would inform reforming housing and food systems together, recognizing how interlinked they are, and help generate wealth building strategies that would transfer resources, both political power, property, land, resources to the community, and have accountability and feedback. So we partnered with the Duke Environmental Justice Lab, which I co-lead with Professor Chris Timmons in the econ department, to do the quantitative analysis, and then with the World Food Policy Center to work on developing workshops and programs that would engage community members in generating policy ideas around how to reform these systems. So this bottom graph is just one example. These are very preliminary findings, but what the EJ Lab has been doing is taking all of the organizations that are engaged in securing affordable housing in Durham and have been over time for the last 20 years, and really looking at, okay, what neighborhoods did they do the intervention in? Where did they rehab houses, and to whom did the house go in terms of social and social identities and income? And then we look to see, well, did that match the neighborhood? Are the people who live in the neighborhood benefiting from these interventions? And what's the wealth distribution look like? So these are just two examples, again, preliminary results, showing that, it looks like these two intervention organizations are matching well as far as social identity and race. And the one on the top, the wealth of the people who are getting the affordable housing is a little higher. So we're working on finishing that up. The other thing that we did as part of the grant this year was to host the Rooted in Relationship, Power and Privilege in Food Systems Conference that the World Food Policy Center and CIP and the EFOD, Equitable Food Oriented Development Organization, hosted here at the end of April. And the EFOD's criteria is equity and justice first, people and place-based oriented strategies, using market-based and business strategies to build wealth, and then really having community leadership and community organizing reflected. So researchers, representatives from organizations around the country came together to talk through, from a food orientation, how we could address some of the food and housing, affordable housing crisis through this community-rooted approach. With that, I will stop because I think I'm at time, and I look forward to further discussion and questions.
Thank you so much, Dr. Jowers, and thanks to Ms. Smith, although she's no longer here, but thank you so much. That really is incredibly rich food for thought. Again, for those folks who are in the audience, please do put questions in the chat or through the Q&A function, and we will be getting to them later. I'd like to introduce again, next up is our Families and Communities Rising. I think Dr. Jessica Sperling will be representing that group.
Yes, thank you so much. I had developed this presentation in close collaboration with Deric Boston, who is not able to join right now. So I'm going to do the best I can to speak for him and to our partnership together. So today, for the next little bit, we're going to be talking about collaboration between Duke and Families and Communities Rising as a brief overview. And this was through some connections with them to me, Duke Social Science Research Institute capacity, but in that I also do a lot of evaluation with CTSI Lens as well. I also, before I begin, do want to acknowledge many others involved. It was not just me. It was not just me and Deric. There are teams from Families Community Rising and from Duke. And so although the other faces and voices are not here, I want to make sure that it's clear that this is absolutely a broader team effort. So let's start off by talking a little bit about maximizing efforts to include males within a Head Start environment. And this is really the focus and the priority of this particular collaboration about which we're speaking. So this might be familiar to some folks, this might not. I want to make sure we're all on the same page to start. Family engagement is a strength-based process, right? Drawing upon the strengths of all involved between families and childhood professionals, right? And the intent behind family engagement is to create benefit for families at large, right? Understanding, of course, that children don't exist in isolation, they exist within the context of a family or caregiving unit. And within this, a real priority has been to focus on, for families and communities rising in particular, I'll say, has been to focus on male caregivers, right? And when we think about family engagement, not just thinking about mothers or grandmothers or aunts, but thinking in particular also and prioritizing and trying to elevate and facilitate the involvement and engagement of male caregivers. This is important for any number of reasons. I'm not going to get into all of them, but they serve male family members and father figures serve as key roles in healthy development for children and families. And again, from a strengths-based lens, there is a lot that they have to add to Head Start communities, right? A lot of potential that has not yet necessarily fully been harnessed or realized. And so with this, Families and Communities Rising over this past year, right? This has been a collaboration that's really kicked off, just about a year ago, and continued throughout this year, has been looking to develop in particular a man-to-man male engagement opportunity, right? So this is a dedicated time, space, focused program that is solely and specifically about male engagement, carving out this space. And what did this look like, you might ask? It started with engagement that's already happening, right? This isn't starting from nothing, and building out a regular schedule of events, programmatic offerings to males, right, within the caregiving unit, to bring them into the fold, to give them supports and resources that would be helpful to them, to help them facilitate engagement with the youth that they care for, and to make sure it's clear that male engagement is absolutely critical, valuable, and viable, and something that Head Start really wants to encourage and allow for. So that's been the focus of this project and collaboration in Families and Communities Rising over this year. Now I want to talk for a moment about how we collaborated, right? We being Families and Communities Rising and Duke partners. So a few highlights. There was an initial connection made, right, from a CTSI entity, given Families and Communities Rising interest in evaluation, which is an area in which I focus and specialized. As they were developing this programming and implementing this programming, they thought, and I would argue rightfully so, how can we better inform what this is as we go forward? How will we know if it's effective? These were questions they were asking themselves, and through established relationships, right, I got brought in along with a number of others to conversations to help them answer these questions, right? To help them really think about sort of these strategic development and evaluation research questions and how they could best address them to understand the work they were doing and to improve the work they were doing. So with this, we established working meetings, a series of working meetings that were held monthly or every other month, starting, it was a year ago, May of last year, so over the year, right, as a regular mechanism for engagement. And what happened at these working meetings? Generally speaking, at these working meetings, Families and Communities Rising shared updates, what they've been doing, and next step ideas, right, regarding their programming, but also regarding applied research and evaluation, right, to understand the effect and inform where things go. And Duke partners listened and provided input, right? Sometimes sort of micro level, let's review this survey together and what might we adjust. Sometimes a little more step back macro, or what is it we're really trying to learn and how do we get about that? From a variety of perspectives, but really focused on what they were sharing with us. I'm going to talk a little bit about the facilitators of successful partnership in this case. And I'll say one of the things that Deric and I talked about was, is this successful partnership? The last thing I want to do is say, I think it is, and therefore it is, right? But we thought collectively that yes, in fact, it was by and large successful from a mutual benefit standpoint. And let's think about what some of those things were that facilitated that success in partnership. So one point was a prioritization of the interests and needs in Men of Head Start and the male-to-male programming, with Duke partners really situating their input, our input, within their context and their priorities. And this is partly related to how this collaboration developed. We didn't come to them and say, hey, we want to study you. Can we study you, right? It was actually a very responsive partnership where they said, we would love some sort of empirical applied research evaluative expertise. And we said, we think we could probably do that, right? And so we really prioritized what they were looking for, which doesn't mean that we were just kind of passive receptacles, but we made sure we kept that front and center of mind at all times. A second facilitator was Men of Head Starts, this is within Family and Community Rising, desire for and openness to input. And I think this is to their credit. They were not ever defensive or said, well, this is how we do it and we think it's right. In part because, again, they were seeking this partnership. So when we had suggestions or ideas or things that we wondered about, there was consistently this welcoming understanding of, we're glad to hear that, right? And sometimes it was spot on and sometimes they pushed back a little bit, but they were really open to and interested in hearing input. And this was combined with their proactiveness and their effort. So this is something in many cases they were really leading, right? They were taking things, they were moving forward, they were taking input, they were making adjustments and then sharing back where they were and getting additional feedback. But they were playing a very active role in this process. And a third point, and this sounds super basic and just logistical, but you know what? Sometimes those basic logistics are really critical. We had regular meetings. We had functionally about monthly meetings. Sometimes we canceled them. We said, we don't really have anything on the agenda. They said, we haven't really been focused here yet, so we don't have a lot to talk about, and we canceled. But we had that regular mechanism, that set mechanism for communication, right? So we had an open way to exchange all the time, and we used these regular meetings as working meetings, right? And so everyone wasn't given a ton of homework to do in between. We did that sometimes, right? But we really prioritized using those to work through the questions at hand with that regular and ongoing engagement. And with that, I want to close by speaking to some of the benefit. And I will say, regarding the benefit, I had asked Deric as we were co-planning this to put this forth himself. Again, I didn't want to say what the benefit to them was. I wanted to make sure that they were speaking to that. And so I want to provide that particular context here. So per the perspective of Families and Communities Rising, what is some of the benefit that they saw? Input on scheduling data collection to understand program impact. So when do we collect data? When in the life cycle of a program do we think about this? Assistance in brainstorming regarding strategies to improve programming. And so here's where we provided some interpretive partnership, right? Where they're saying we're seeing this sort of response to this most recent survey. We said, well, what does that mean, right? You have an understanding of that from your context, and we have some additional perspective that can take findings and move them into action. Providing a sounding board, a knowledgeable sounding board, again, as a voice to respond to questions that they had and really listen, right? Really listen to what they're saying and then share perspective that we might have based on what we're hearing from their context. Broadly offering insight into improved data collection tools and processes. So I spoke to this a little bit, right? In terms of survey design, we did this in also some other cases where we said, well, how do you collect data, right? Pragmatically, how does that happen? And then feedback on measuring outcomes, right? So not just how do we collect data, but how exactly do we even measure these intended outcomes or unintended outcomes, really, that we might be observing or be wanting to observe. And with that, I want to stop talking. I do see that Deric was able to join, so I want to see if we can take one more minute or so, if there's something additional that he wants to add broadly about the partnership, benefit or otherwise.
So first of all, I want to apologize for being late. I had a technical meltdown right before, because I changed my locations. I should have not done that before I started to get on. But I just want to add that I don't know where we left, but the benefit for us, Families and Communities Rising, was really able to have a group of people that could look at what we were doing and giving us really good feedback. Because again, as direct practitioners, we're close to the work, and it was really good to be able to download some of the things we were doing, get some feedback from someone that wasn't close to work, but also someone who could understand specifically where we were trying to go, to make sure we're going in that direction.
Thank you so much. With that, I think we'll stop for the moment. And if there are any questions for us, and for Deric in particular, I'll say, but for us, we're absolutely happy to entertain that when it is the question time.
Thanks so much. Yeah, Mr. Boston, I think if there's not a watchword for the last 2 years, technical meltdown would probably be it. So thanks for seeing it through and for joining us. I really appreciate it. I know what that feels like, and I deep breath. Anyways, we also will have chance to you will have chance to respond and reflect when we have our question and answer period too. So we'll look forward to hearing from you more then. Next up, though, we do have our powerful team from the University Assisted Community Schools program. I will let you take it away. I'm so excited to see your presentation.
All right. That's cool to be introduced as a powerful team. We feel that way, but it's nice to hear other folks. Hey, good afternoon. Happy Friday. We are going to be presenting on our work around University Assisted Community Schools. My name is Alec Greenwald.
I'm Xavier Cason.
And I am Yolanda Dunston, trying to find all the controls at the bottom. So thank you for your patience.
So as Director of Community Schools in Durham, I get this question a lot. What makes a community school unique? What is a community school? The quick answer is this. So much of what's been said already by keynote speakers and panelists is in harmony with what's on this page and what's in our work. I really don't have to even refer to the slide because you've already heard so much of it. Now, the younger version of myself would have given you some quotes from things I've heard this morning, but the current version is just glad that it's been recorded. So I would like to point to that fourth bullet. It just talks about how the schools and community partners share leadership. And school community, to me, and to those of us working in this, the school community is the principal, the administration, the staff, the parents, and community partners all at the same table together making decisions. We can go to the next slide. There are many flavors, as I call it, of community schools. They've been around for 100 years, but the NEA a few years back actually did some research and looked at the most successful and impactful community schools in the country and realized that there are 4 mechanisms that they have in common. They actually hire a community school coordinator to actually do the problem-solving work within the school. They actually do a needs and assets assessment. The goal is to have input and feedback from 75% of your staff, of your students, of your families and caregivers. And then the data from that assessment is analyzed by problem-solving teams. And then those teams and the school reaches out to partners that can directly speak to what those problem-solving teams have found. Next slide, please. So this is a timeline of our story so far. The partnership, of course, includes Durham Public Schools, Duke, and NCCU. We do want to make sure that it's clear how important it was from the beginning as we talked about imagining community schools in Durham, that we take advantage of the power and expertise that we have at North Carolina Central University and Duke University. During that second year, after talking to university officials as well as many community leaders, while we piloted 4 schools here in Durham Public Schools, the community leaders in our universities applied for BAS Connections to fund our undergraduate research program. And over the next 3 years in this timeline, while the BAS Connections University Assisted Schools group, we call it the BQACs, started doing their research, you'll hear more about that later, DPS started housing the program and the partnership inside the foundation. And we just recently launched a very formal steering committee to oversee the implementation and expansion of our work. Next slide, please. Here's just a few snapshots from the impact so far. Before and after community schools, Lakewood and Club elementary schools has seen really great gains in their proficiency and growth. 20 percentage points, 26.8 percentage points at Lakewood, 14 percentage points, and almost 30 percentage points at Club with their proficiency and growth. Next slide. And here's one example of how important the horizontal leadership and two-way communication is for us. In that initial needs and assets assessment, Club Boulevard, with a goal of 75%, only really got 40% of actual feedback in their assessment. So that problem-solving team took that challenge, got up to 60% over 2 months, and realized that they could use the same app that you and I got the last month from politicians wanting your vote or your donations, the Hustle app. We actually purchased a license to the Hustle app, and now at Club Boulevard, we can actually receive the feedback from 99% of our families within a week. Next slide. Al, I believe this is you.
This is me. Yeah, so as I always like to start off this work by saying is that you've gotten just a glimpse of the community school work that is happening in town. Community schools are not new. They've been around for the last 100 years. And as Xavier said, they look lots of different flavors in different spaces. But the work going on here in Durham is going to be happening with or without Duke and North Carolina Central University. But when the campaign began, we started to myself and colleagues on both campuses began to think about where we fit into the work. And this is just a little bit of the landscape of community schools. So starting on the far left is the Coalition for Community Schools. That is kind of like the large umbrella where all of these different flavors fit under. Above that is the NEA model, right? So this is the model that we are following. It's the National Association of Educators. The Bull City Community Schools Partnership is what we call Xavier. It's what we call Xavier, and it's what we call the community school coordinators at Club and Lakewood, and it's what we call the parent organizer, and it's what we will call other Durham public schools that begin to become community schools as we expand. We now have a community schools governance board made up of folks inside and outside the school district. And on the lower right-hand side, you have a consortium of folks called University Assisted Community Schools being led by our colleagues up at University of Pennsylvania. And it's a network of universities across the country that are thinking about how universities relate to this work. And then there's us. And so in year one, so one of the really profound things about the community school work is that for the first year of the project, they do an asset needs assessment, or otherwise called a deep listening project. Xavier mentioned that they want to talk to 75% of their school constituency. That's pretty easy for teachers and students. It becomes a much harder ask for parents because parents are busy. And so they did it through all sorts of avenues: racial caucus groups, surveying, focus groups, all social science, school social science methods. And out of that first year, so they lifted no brand new initiatives or fancy red carpet programs, right? The first year, all they did was listen. And we initially came into this work thinking, okay, they're gonna come out with some needs, and us with the luxury of being on, researchers on university campuses will be able to identify best practices around the country. But what we realized is that as they were identifying needs, they were figuring out, they were doing problem solving within their schools, and that the timing didn't work out, and it was actually kind of presumptuous of us. And so we actually pivoted and started to do a lot more kind of introspective work around how we could be more responsible partners, how we could be more imaginative partners. And so we had a hypothesis that we could be doing both of those things better. And so our students did peer interviews of their folks on both campuses that were entering Durham Public Schools by way of service learning or clubs or organizations. We talked to faculty and staff that were sending their students into public schools, and we led a focus group of Durham Public School teachers. And we learned, and our hypothesis was accurate, that there was gaps in cultural competency, context setting around Durham, and then content and teaching strategies. Our next year, which was our COVID year, was a tough one, as we all know, and we really did a whole bunch of confirming our hypothesis. And so what we wanted to do, we had already dug relatively deep into Durham, and we wanted to understand other folks around the country. And so we spoke to about 25, almost 30 different universities through individual interviews and focus groups to find out essentially how they are sending their students into public schools and what that kind of cultural competency curriculum looks like. And we learned that it varies. That's largely what our findings are. A lot of like the more kind of poignant work around that is happening in pre-service programs where they are specifically preparing teachers to enter schools as teachers, and that it varies pretty dramatically, and that actually there's not really one terrific model of how they are capturing all undergraduate students that are entering public schools by way of different avenues, tutoring, mentoring, etc. In between the summer of, summer 2021, last summer, we started to begin pivoting towards creating a curriculum for undergraduate students entering public schools, and use the Data Plus program as kind of a vehicle to expand upon that a little bit. And so we created this, we didn't create anything. These brilliant students created a dashboard, an online space that looks at Durham public school communities through an asset framework, right? So oftentimes we talk about public school communities and we talk about them through a deficit perspective. Suspension rates, poverty index, free and reduced lunch, etc. What would it look like? What would it look like to think about communities through assets, where community gardens exist, where healthcare facilities exist, where sidewalk coverage is, et cetera, et cetera. And so they created a really brilliant dashboard that we're actually going to kind of begin. We dug into a whole bunch this year and got a bunch of feedback. Yolanda will speak to that this year, and we'll be expanding actually through Data Plus this summer again.
So year 3, which is the year we're currently in, has been spent with more research and data collection and designing those products that we've been talking about for using with the stakeholders, which include the community of Durham. So this year we divided our team of student researchers up into 3 sub-teams, which focused on 3 separate research questions. So the first research question that was addressed by one team was, how do we best prepare undergraduate students to enter Durham Public Schools classrooms with a critical lens for race, class, and the history of Durham? So that team, which had about 4 or 5 students in it, they started out with the SWOT analysis, which is of course strengths, weaknesses, opportunities, and threats. And we were really trying to examine what the need was, examine that actual need for an anti-racist curriculum, like what might be some of the barriers, what might be some of the outcomes. The group also reviewed data collected from years 1 and 2, because we had some really rich data that our first 2 teams of students collected. And we examined that to figure out what else the stakeholders might have identified as needs in a curriculum. And some of the key findings showed that there was an overwhelming need based on reports from teachers, faculty, and undergraduate students, that they wanted more volunteer preparation, specifically regarding anti-racism practices, introducing volunteers to the history of Durham and Durham Public Schools, and strategies to help engage with students, families, and the specific community of Durham. So that team developed, that team developed a curriculum by first outlining some objectives and then turning those objectives into topics and activities that eventually comprised 12 modules that can be used as college students prepare to go into Durham Public Schools to volunteer. Now next slide. So the second team addressed the research question of, can community schools serve as hubs for broad health services that meet the needs of community members inside and outside public school buildings? So the second team really thought about engaging in new research where they identified Durham Public Schools that both served a high population of free and reduced lunch, which is of course a poverty indicator. And the schools also had limited access to health clinics. And the team found that there were 11 schools in DPS that met this criteria. They had over 80% students that were on free and reduced lunch and were more than a mile away from a health center. So after contacting those schools, the second team was able to conduct an engaged and parent-led focus group. In those groups, the parents did indicate that they had a variety of personal experiences with healthcare facilities. They had some concerns and they had some things that that were on their minds about how their kids' healthcare needs were being addressed inside and outside of school. So that is something that we'll need to continue to address. Let me see, there is another team. The third team talked about how do we build a robust online dashboard that prepares undergraduate students, DPS teachers, and DPS parents to understand their neighborhoods through an asset-based perspective. And that just goes back to what Alec was mentioning from the Data Plus dashboard that was begun, the development was begun over the summer. But the key findings that this subgroup discovered in their continued work was through feedback provided from principals who were allowed to look at the dashboard and kind of see where it's good, where it might have a little bit of need. They discovered that the dashboard needed to be more sustainable and it needed to be more language inclusive given the number of Spanish-speaking families in the DPS community. And the principals also wanted the information to be easier to understand by the parents and community members. So year 4 will have continued work on that dashboard and making it sustainable and inclusive. Year 3 also brought back the opportunity for site visits, which made us really happy. Site visits began in year 1, but they were put on hold in year 2, of course, due to COVID travel restrictions. But students and team leads were able to travel to actual community schools and university-assisted community school sites to learn more about how they got started and how they currently operate. Some of the places visited were New Mexico, Las Cruces, New Mexico, Philadelphia, Cincinnati, Orlando, Milwaukee, New York. We've been able to go all over the US, which has been incredible because these visits have been some of the favorite experiences as our students and team leads get to interact with these communities outside of Durham and gather ideas for how we might bring what they're doing into our own efforts to match the Durham community.
I have to find an unmute button. So as we continue this, we are really strongly working on an expansion of this program within Durham and surrounding counties. So I was in a meeting this morning, as a matter of fact, looking at how we can possibly do a joint regional expansion of our efforts to apply for a full service federal grant for community schools. We also were in meetings this week with other leaders from the North Carolina Association of Educators and different counties around the state who built a coalition and like, what is happening in Durham and how can we possibly replicate this in our counties? The dashboard that was mentioned has been presented around the country. We have students who have been in presentations like this and symposiums like this, talking about how that dashboard is being developed even as we speak. And of course, the curriculum that Dr. Dunston mentioned is going to be shared with faculty at Duke and NCCU and other institutions for feedback and potential piloting as we move forward. And one more bullet that's not there, that is heavily on my heart, is that we hope that as this partnership continues to grow, that there will be community school coordinators birthed out of this program as well.
That's us. I saw a question that I know we'll have time to address later, but two people asked the same question about, is the curriculum available for folks to use right now? Not yet, but I'm going to take folks' name down because we're actually going to be seeking out faculty on both campuses to kind of help pilot it for us. So that's us. Thank you so much for your time.
Thank you, you three. Wow, it's really wonderful to see not only the incredible impact of your work, but also how well you work together. So that's really evident in the way that you presented. I'm gonna just actually ask one question, follow-up question that there is in the chat to you three, and then we're gonna go into more general questions. The question is this anti-racism curriculum adaptable to university courses? Apologies if you mentioned that already.
You're muted, Dr. Dunston.
I started the video and didn't start the sound. We did not mention whether or not it could be adaptable to other courses, but we imagined as the students were developing this curriculum, we imagined that there would be some parts of it that most people would want to use, and then other parts that they could take and use as needed, like maybe module 3 really fit, or maybe module 7 was more important. And the students have actually put in ideas for options for if an environment doesn't work for your class, then here's an option that you can do instead. So we are building into the curriculum the idea that it needs to work for more than just one specific entity. So that will be introduced probably this fall.
Thank you for that response. I will move to a more general question that I'd like to ask all of our panelists. And I think that there probably will be some questions that pop up in the chat. We can try to get to those later, although our time is short. So panelists, if you see questions you'd like to respond to in the chat, please feel free to do so as we're having this broader discussion. The question that I have for you though is, it was similar to one that was asked actually in the first panel discussion this morning too. And it's really about the fact that, and this was a theme that I certainly heard throughout your presentations today, that communities and universities often bring really different types of resources, knowledge, and skill sets to partnerships. Can you provide some examples of what the university and community brought to your partnership and how that helped to achieve the goals of your particular collaboration? And then I think if you can also provide some examples of particularly impactful strategies that your project employed that could not have been successful without that combining of different resources, perspectives, and abilities, capacities. And I will, if it's okay, I think I might turn to Dr. Jowers. Are you okay to answer that question and take that? And we'll just kind of go in order. And then I'll go to Dr. Sperling and Mr. Boston.
Sure, thank you. So I think for our partnership, what CIP brought was a commitment to holding the university partners accountable for having a racial equity lens and for respecting that the community members had the expertise around what their community needed, and that we were to be on tap, but not on top with our expertise. And then what the university team brought, Dr. Danielle Spurlock, myself, Kofi Boone, Deb Gallagher, we were all very interested in breaking out of the entrenched model of university research. We didn't know quite what that was going to look like, but we did know that we wanted to use an asset-based approach to finding a community partner. So, and that we were committed to trying to break out of that entrenched model and respecting community expertise, including compensating community members for their engagement in our research projects. So to answer the second question around strategies, the fact that CIP is so committed to making sure that community expertise is respected and in the same ways that a lot of academic and university expertise is, that made it possible when we were doing the E5 planning for the Rooted in Relationship conference. We were committed to making sure that the people who participated from the community were compensated. So we were able to pay stipends for their participation and to really compensate them in a way that was paying living wage. So thank you.
Thanks for that response. Can we hear from you, Mr. Boston, perhaps, and Dr. Sperling?
So can you restate the questions? I had some noise in the background.
Of course. So just that thinking about the different types of resources, expertise, sets of skills that universities bring versus communities bring to these types of partnerships.
Yeah. So I think it was a really good marriage for us, because even though with the way we started having to kind of search for what each entity was bringing to the table, and in understanding, being able to take information from our constituents and from our the dads in our program and the male caregivers, and actually use that in our conversations with the university participants to and having a discussion amongst ourselves as to get down to what those dads wanted. We had some really good surveys in terms of interest and need surveys that brought a lot of information to the table. And then I think starting from there, we could then see what elements we wanted to implement. And I think a couple of our dads actually act as consultants. So then they were able to give us more information in terms of how to operationalize some of their ideas. One of the things that comes to my mind is we have an event in March, it's called March Madness, in which the fathers actually throughout the year, they create some activities they want to do with their children, and then we implement those and then give them points throughout the month of March, and whoever has the most points in the March actually gets a prize for that.
Thanks. And I'll add just a tiny note. First of all, like that's a great example, I'll say, of some of what you all brought, which is an understanding of the folks that you work with, right? You work so closely. You've cultivated and built and developed and really invested in these relationships. It gives you that proximal, I'm just thinking like, what if Duke sent a survey, we designed a survey and we sent it to, fathers and males, it would have been so much worse because you understand where people are coming from. You understand even from the mechanisms of like, when do we collect data and how, what are going to be things that really facilitate buy-in, meaningful buy-in, right? Where this is all not just for us to gain knowledge, but to inform what we are doing, what you all are doing. And you have the contextual expertise, hands down, without which our involvement, I don't think would have, I don't want to say it wouldn't have done any good. I hope it would have done some good, but not anywhere close to what happened.
Thanks for that. It's wonderful to see you in conversation too. So thanks. I think, can we hear from University Assisted Community Schools? Do you have a response to that as well?
I do, but feel free, team, to jump in. Two things that I think of. One is the power of our interinstitutional collective. I think that our institutions have different values, right? This project has been funded by Bass Connections, which lives at Duke, but it's really hard to get to pursue a degree in education at Duke or a degree in social work at Duke. In fact, you can't major in either, and one doesn't even exist, right? Whereas at Central, they are pumping out educators, they are pumping out social workers. So we are thinking about education in really different ways. And then the other is I'll just kind of start where I started, and that is that this work doesn't exist without the folks on the ground, the practitioners in community schools. So we've really kind of tried to continue looking back to those folks on the schools. And so our research, our methodology is totally informed by their work. So we didn't know what continuous improvement science was until we brought in community school coordinators to say, this is how it works on the ground. We ask a whole bunch of whys and we move backwards until we get to the thing that we're going to try to address. They instill the motto in us that we're addicted to problem solving, right? And that it's iterative. I don't know if Yolanda or Xavier, if there's anything I'm missing. Cool.
Thanks. Yeah, I think that interinstitutional part is really important to think about as well. These aren't just, these are very, especially from the morning, I think even perhaps more so, they're incredibly complex multi-institutional collaborations, and that introduces its own complexity, but also its own richness and strength if you can draw on the strength of each of those institutions as well. So thanks for that perspective. I also know though that from doing this work myself, that community university partnerships often have to navigate differences and priorities, cultures, and even timelines, and other things as well. So I'm wondering if you can provide some examples of how your partnership has navigated these differences. What perhaps name them, and then think about how you've had a chance to navigate them, or you've been able to. And this time I'm going to leave it up to you to decide the order. Who would like to jump in?
I can go first. I think one of the things that we found is that the group that we were working with I feel like the first few sessions were somewhat like listening sessions, right? So where they didn't necessarily provide input in the first few sessions, and it felt to me as though they were really trying to listen to what we wanted our deliverables to be. And I think what that offered for us is that offered for us an opportunity for us to kind of dump what we know, so to speak. And then maybe in the third session, they kind of cleaned it up and gave it back to us to confirm that's specifically what we were talking about. And then we started working on the data sets, and then we started working on some of the things that we wanted for an outcome, because I think if they would have started any quicker, it probably would have been a little bit overwhelming trying to figure out where to put all this kind of maybe theory into our practice, as opposed to doing it the other way around.
I'll chime in if that's okay. Mm-hmm. With the University Assisted Community Schools project, we did hit one little snag with there being differences in values and what's allowed. So one of our teams was trying to conduct parent interviews, and Durham Public Schools put a halt to that. Durham Public Schools has stopped allowing undergraduate research. And so our team, who had fully depended, or one of our 3 sub-teams who had fully depended on getting this information from these parents, had to quickly pivot and come up with an alternative way to still get the information, because of course, as Alec was saying, the heart of our work is listening to what they said they wanted. We don't impose our ideas onto the school system and the community. We ask them. And so the team was able to, I don't even know, I believe I would need Alec or Xavier to chime in, but they were able to somehow make that parent-led focus group happen. Can you guys speak to that? I just know that the DPS was like, nope, you're not doing that. We don't do that. So we had to rethink how to get things done and still be ethical and still be respectful of what the school system finds appropriate, which we understand. They're very protective of their students and how their story is told. We completely understand that, but we still wanted to hear from the parents.
Yeah, and also too, I think that policy has shifted in just that because of the current state of our public schools, that they really need folks inside the schools to focus on teaching and learning, and they can't be bothered with undergraduate students right now. So I think we get that, but it was a snag for sure. We identified the 11 schools. We reached out to all the principals, vice principals, social workers, counselors, et cetera, and got crickets. One principal responded to us. She said, do you have approval to do this through research in the district? And then we got looped into kind of like a slap on the wrist, and the rationale behind it. It wasn't that we couldn't do the work, it was that we can't bother administrators with it. So anyways, long story long, is the way that we ended up doing is we had a personal relationship with a parent who said, I'm happy to do this, had a relationship with the principal and was able to lead a focus group. And we were able to pay participants through actually through this collective. We were able to receive some funds to pay parents for their time and their expertise.
And please know that I'm working on the slideshow along with these two. We're going to go right back to DPS and here's a way we can get this done, because there's a way. This is a partnership, and DPS is a partner, Duke is a partner, ECC is a partner. So in the name of partnership, we're going to get around that.
I'll just add, for our team, we try to meet the needs similarly of when we have engaged learning and students involved in the research. We try to balance the burden that might be placed on CIP and the other community partners by bringing students directly in. And that's one of the reasons why we have the EJ lab, is that we can have the research staff, myself, and the faculty be the bridge and bring students in. The students are really getting to do work that's deeply applied and in service to the community without creating a burden on the community partner to supervise or direct student work. And so we take that approach. And then sometimes it is very helpful to have a full-time research staff member involved, because I don't go anywhere in the summer and the breaks when the students are away, and faculty have other commitments throughout the year. So having that continuity is incredibly helpful as well.
Dr. Sperling, would you like to jump in as well?
Yeah, I've been thinking a little bit more about this, and we're still, just to like affirm, we're still thinking about the impactful strategies. Well, I'm still thinking about that. We're still thinking about that. I don't want to just echo Mr. Boston for the sake of it, but I think it was really important to listen, to start off by listening. In our particular case, I'll say, but I think that's true broadly in other, work we've done in this vein. We could come with all this expertise, but we don't know what's the right fit for the context until we better understand the context, and we better understand the needs, and we better understand the interests. And so I think that starting by listening, and not just listening, but asking questions. We asked a lot of questions to better understand. And that combination, listening, asking questions, and developing that base was really helpful. A second thing I'll note, and I know we talked a little bit about this in the presentation and sort of facilitators for success, but one was the way that Deric and his colleagues really moved things forward during the meetings in the way that they thought appropriate. So they were just phenomenal at taking input, guidance, suggestions, ideas, and making it a reality and moving it forward and then coming back together. And I think in terms of getting stuff done and getting stuff done with the amount of time that we had together, that was absolutely critical.
Mm-hmm. Thanks, Dr. Sperling. Yeah, for that additional insight. I think actually, I'm going to give Mr. Boston, you put a comment in the chat. I just want to give you some time to talk that through if you'd like. And then there's another question from Elizabeth Brown as well.
So I was responding to a question in the chat regarding who the participants were. Since I was late, I didn't actually get to explain that part. So I was answering the question there. So the participants on the FCR side we had two male engagement coordinators, and their full-time job is to figure out how to embed the males into our parent engagement program. So we really emphasize parents being engaged in our classrooms and throughout our program. So our emphasis is not to leave the male caregiver behind. So in order to do that, we have to push them into, well, not when I say push, encourage them to come into spaces they typically may not come into, because in early education, everyone looks to the mother to either answer questions, to come and volunteer, those kind of things. So their job really is to make sure that teachers, that our environment, that we have a male-friendly environment, and also that people are mindful that there is a father, there is typically a male caregiver for a lot of these children, so not to leave them behind. And then another question was asked about how did we build trust? Our male coordinators are on the ground every day. So 5 days a week, whenever there's school, they're doing something in the centers. They're meeting fathers on the sidewalk when they're bringing their children in. Also, what they're doing is whenever they encounter moms, they're asking about the male caregiver, be that a grandfather, be that a father, be that a cousin, whomever they may have seen one or two times, then they will ask about that person. So then what ends up happening is that female caregiver may go home and say, hey, Mr. Sean asked about you today, right? So that builds a level of trust as well. And Oh, and then we do have male-oriented events, right? And we make sure, again, our environments are father-friendly, so that they feel as though that this is a place where they can come into our environment. And then one question was asked if we compensate. The only compensation that we give, and this is really a prize for a competition, is the March Madness. We have a first, second, and third prize. In addition to the father being able to win an award, teachers and their case managers are able to win an award too. If you're a teacher with the most male participants during March Madness, then you actually can win a first prize. And what that does is that motivates our teachers to encourage the males that are associated with their classrooms to participate. And we don't compensate, because one of the things we're trying to embed with our fathers is that improving their parent-child relationship and their co-parenting relationship. So really, that's what we consider as our compensation, is having a better opportunity to spend time with your child and understanding the benefits of that.
Thanks for that further elaboration. I really appreciate it. And such a fascinating program. We do have one more question, I think, that we can take time for. So we have a question from Elizabeth Brown for all the panelists. Understanding that much of your programs and work is dependent on securing funding from institutions, is there one element of the funding process that you would change? I think I will also add, how do you navigate different funding sources and opportunities from the community side and from the university side? Because that can be a challenge as well, I think. And I think also, I know that this could be an entire day's session. So if you want to reflect perhaps shortly on your thoughts, that would be great. Who would like to jump in? Alec, go ahead.
Yeah, just briefly, because I know we're short on time, is that we have been funded through Bass Connections and Data Plus. We're super, super grateful. It's been a phenomenal vehicle for us. But everyone, all of our team leads do it out of the goodness of their heart or because they're passionate about it, right? So people put a lot of work in this, and people are tired, right? So our strategy has always kind of been to put our head down, do the work, and show and prove. And that has started to, in really small ways, bring in other opportunities for more sustainable funding, right? This collective is one example of that. Xavier and myself and the foundation and a whole bunch of other partners are looking at a massive federal grant for the expansion and sustainability of full service community schools. So that's a little bit of kind of our funding process. Is like, we've gotten some seed fundings that have enabled us to kind of show and prove, but this work needs to continue, right? And that's not a sustainable model for much, much longer.
Oh, sorry, go ahead.
I was going to say, for Head Start, there often is some federal funds, so we may write for a few grants that can sustain some of our activities. We also do extra. There are extra with our funding model. There are extra funding streams that we can take advantage of to create some positions. But I do want to give a big shout out to Dr. Sperling and Patrice, that we've paid like lots of money for the support they're giving us, and their support is excellent, and we get that for free. I probably shouldn't say that out loud. I may get an invoice for that, but we really enjoy working together, and that has been of great benefit to us in our environment.
I'll just make a quick note and advocate. I'm not seeing any like major funders on this call, but we're there. I would say this is so valuable in what we need. And I think one of the things that actually is really, I don't think we noted this about our partnership, was that it wasn't a heavy touch, in terms of the time. As I said, we had working meetings about once a month, sometimes a little bit less, right? It wasn't necessarily and this is not true of all partnerships, and I'm not saying all partnerships should look like this, because I don't think it's true, but I think that there is real value and real power in kind of an ongoing supportive mechanism that doesn't necessarily require a huge amount of time, but gives significant value. And that's the kind of thing where I would say, you know, institutional support. And I know I'm going to shout out, you know, Duke Civic Engagement has been looking at some of this. I don't want to say that out loud either. But that sort of thing, you know, in terms of having community benefit, community responsive partnerships without a huge time commitment, you know, it's something to think about.
I absolutely agree. I think bang for buck, that's probably the best spent time that I have each month, because we're it's very concise and it's very pointed and very concentrated. So I absolutely agree.
Yeah, thanks for those insights. Dr. Jowers, would you like to add?
I would say if there was one thing I could change, it would be that relationship and trust building as an outcome should be funded. That is the thing we were funded for originally in 2015. We could spend the first 2 years really establishing the relationships, showing our community partner that we were willing to go to whatever racial equity trainings they wanted us to go to show that we were committed to their vision of how their community should be. And I do wish that there were more opportunities for other teams to have that sort of support where you're not under pressure to produce research, publication, but that you are allowed to really establish that strong basis of trust that you're competent to do the work that you're an expert in, but you're also competent to do community engaged work, and that you truly have their best interests at heart when you're working with communities that you don't necessarily live in. So I would change that. And then, yeah, if we could just make sure that we have the ability to fund our community partners and compensate them for their time.
Yeah, such a challenge, both of those things, I think, Dr. Jowers, thanks for identifying those. I'm gonna, Dr. Dunston, Xavier, Cason, would you like to take us out? Any final thoughts? No, or you don't have to. Sorry, I didn't mean to put you on the spot. Okay.
I just want to say again, as I said earlier, I enjoyed the synergy and all of the themes of harmony that I've heard. We're all doing very much similar work. And I just hope that we get great results.
And I will just say back, I think you already have. Let's keep up the good work though, huh? And those partnerships. Yeah, it touches my heart. So thank you for all that you've shared today. We are going to move into our exit from the symposium, but I do want to offer to our panelists that if you have resources or links that you'd like to put in the chat to share with everyone who's attending, please do so, just so that they can find out more about your programs or the resources that you have to offer as we head out. I will say though, I really want to give an incredibly heartfelt thank you to our panelists from this afternoon. And I'll just include our panelists in the morning too, because I think there were so many threads that I could see weaving throughout. I really appreciate your willingness to share your experiences with community and university partnerships, and to doing so with such power, such clarity, such honesty. This is what we need. If we're going to learn from these processes and learn how to do them better, this is exactly what we need. If we are going to value this work more, this is what we need. If we need to have it heard and seen across our campuses, across our communities, this is what we need. And so much more, of course, of all the different work that you all have discussed today. So again, my incredibly heartfelt thanks, gratitude for your willingness to be here and for your willingness to share with us today. I think this is how we get to partnerships that are ethical, impactful, sustainable, and you all have given us a great roadmap for what those can look like today. So thank you for that. I also just want to take a minute before I turn it over to Dr. Mina Silberberg, who's going to be taking us out, to recognize and salute the incredible work that has gone on in the background of the symposium today. You probably didn't see it, you all. by our fantastic organizing team, Patrice Jordan Fleming, Alicia Florwick, and Danielle Thompson. I'd like to ask you all to help me thank them profoundly by showing your love in the chat, if you could. Please thank them profoundly because they made this all possible. And now I will turn things over to Dr. Mina Silberberg to take us out of the formal portion of the symposium. Dr. Silberberg is an associate professor in the Duke Department of Family Medicine and Community Health. She's also Vice Chief for Research and Evaluation in the department's Division of Community Health and Director of the Community-Engaged Research Initiative at the Duke Clinical and Translational Science Institute, which was a co-organizer and a co-founder of today's symposium. Dr. Silberberg.
Okay, great. Thank you so much. What an incredible day. We have heard just amazing stories of how people have brought their expertise, their passion, their skills, and simply their hard work together to act together, sometimes fail together, grow together, and learn together. And to do so to address some of the most critical and challenging issues of our times in areas of health, education, housing, racism, economic inequality, in the environment, and more. And I'll say for my own self, I found these presentations and discussions today to be both enlightening, imparting knowledge, but also equally important, inspiring, right? Helping us to all, I hope, get the energy to keep on doing whatever it is that each of us do. Like Liz, I want to thank the team that put this together. She mentioned the part of the team. She mentioned Danielle Thompson, Patrice Fleming, and Alyssa Florwick, but she was very modest in not mentioning the efforts of herself and the other faculty involved. So in addition to Liz Shapiro-Garza, there was Leslie Parkins and also Leonore Corsino. And I know a little bit about how hard they worked at this. I don't know all of it, and I'm very grateful. I also want to thank our interpreters for today and all the panelists and speakers who made today possible. So I decided to really let the conference move me to what my closing remarks were going to be. And there were a number of things that came to my mind during the course of the day. But I want to, since I am offering closing remarks, I realized that what I wanted to end with is, what is the charge? You know, what is the charge that we're walking away from this with? And when I say us, I think of us as being the community of people who do community engagement, right? People who engage across the campus community. Maybe divide is not the right way I want to think about it, but the campus community sectors to work together in the ways that were illustrated today. And if I may be so bold, I might think of us as a community of people who do this work. So what is the charge that we're left with from the presentations today? And I think for some of us, it may be one thing, and for some of us, it's another, and for some of us, it's a lot of different things. But let me just give my thoughts about what a few of those things are. One is certainly to walk in the footsteps of the people that we've heard from today, right? To do this kind of work. And in doing this kind of work, to continue to reflect on our experiences doing it and to learn to do it better. Another charge, I think, is to spread the word, right? To help people understand the importance of this work, the value of this work. And I think that the discussion that we just had really illustrated why it's important to spread the word. It's important to spread the word in part so that more people will do this great work and we can increase our impact. But it's also important because of the need to do the third thing I'm going to mention, which is support this work, right? This work can be supported in a lot of ways. It can be supported financially, which was certainly part of what people were talking about. It can be supported by trying to make changes to the institutions and systems that we work in that sometimes make it a little challenging to do this, but can also do many things to make it more possible to do this. And I do want to acknowledge that the very existence of Duke Office of Civic Engagement and CERI represents an institutional commitment to this work that was not always there. And finally, I think that we also have a charge to continue to connect. So to connect within our community of people who do this kind of work so that we can learn from each other, continue to learn from each other as we have today, inspire each other as we have today, and also figure out what new partnerships we can make to be ever more impactful in the work that we do. So I'll end with one more thank you, which was to all of you who came and spent time with us today. I know that your time is valuable, and I hope that you found this to be a good use of your time. I found it to be a fabulous use of my own time, and that we will continue to connect and work together. Thank you.
Thanks so much, Dr. Silberberg. Really appreciate those thoughts. It's a wonderful way to leave the session today. I think the charge to continue to connect, right? And to continue to do this work and to support it in whatever ways we can find to do that together. And recognizing that we can't move forward if we're not doing it together. I think, to me, at least, that was the theme that I heard throughout the sessions today, was that we are so much stronger if we are in this together, that the university side as well as the community side, we each have resources and knowledge and experience to bring to these partnerships that absolutely is essential for doing the kind of work that we are attempting to do in these partnerships.